vijana wetu wana ajira, waweza pia kujiajiri. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya.
Sambaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Sambaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali yetu, maendeleo tumeona. Ya ugatuzi ni baraka kwetu, matunda yake tumeona. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi. Nchi ya Kenya imesonga mbele sababu ya uongozi bora. Tunajimudu tukifurahia, uchumi wetu ni dhabiti. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi.
Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Kweli wa Kenya tumebarikiwa na nchi nzuri maridadi. Tutafaulu kuijenga Kenya, tukipanga familia.
Kweli wa Kenya tumebarikiwa na nchi nzuri maridadi. Tunafaulu kuijenga Kenya, tukipanga familia.
Maendeleo tumeyaona na barabara zimejengwa. Watoto wetu sasa wasoma masomo yao, kweli ni bure. Kilimo Kenya kimenawiri na wakulima wanafurahi. Vijana wetu wana ajira, waweza pia kujiajiri. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo
mission at NCPD is to manage the population.
Our mission at NCPD is to manage the population.
Oh, our mission at NCPD is to manage the population.
Our mission at NCPD is to manage the population.
Oh, our vision at NCPD is to improve the lives of
Our
Kenyans.
vision at NCPD is to improve the lives of Kenya.
Oh, our vision at NCPD is to improve the lives of
Our
Kenyans.
vision at NCPD is to improve the lives of Kenya. Kenya to develop, we must learn the population. NCPD has provided validation and guidance. NCPD is committed to manage the population, providing education and improve the lives of Kenyans.
We are calling on Kenyans to Pangeni Familia.
Calling on Kenyans to Pangeni Familia.
We are calling on Kenyans to Pangeni Familia.
Calling on Kenyans to Pangeni Familia.
Let's all join NCPD and support population program.
Let's all join NCPD and support population
Oh, let's all join NCPD and support population program.
Let's all join NCPD and support population program. Attainment of targets of Vision 2030 will help in transforming our country, Kenya. Attainment of targets of Vision 2030 will help in transforming our country, Kenya. Learning our population will help bring development. Our economy will grow if we all plan our families. NCPD has provided policy and guidance. Let us support the government to manage population.
Our mission at NCPD is to manage the population.
Mission at NCPD is to manage the population.
Oh, our mission at NCPD is to manage the population.
Mission at NCPD is to manage the population.
Oh, our vision at NCPD is to improve the lives of Kenyans.
Vision at NCPD is to improve the lives of Kenya.
support population program. Oh, let's all join NCPD and support population program.
And I was using the earphones.
Sambaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Sambaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali yetu, maendeleo tumeona, ya ugatuzi ni baraka kwetu, matunda yake tumeona. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi. Nchi ya Kenya imesonga mbele sababu ya uongozi bora. Tunajimudu tukifurahia, uchumi wetu ni dhabiti. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi.
Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Kweli wa Kenya tumebarikiwa na nchi nzuri maridadi. Tutafaulu kuijenga Kenya tukipanga familia.
Kenya tumebarikiwa na nchi nzuri maridadi. Tunafaulu kuijenga Kenya tukipanga familia.
Maendeleo tumeyaona na barabara zimejengwa. Watoto wetu sasa wasoma masomo yao, kweli ni bure. Kilimo Kenya kimenawiri na wakulima wanafurahi. Vijana wetu wana ajira, waweza pia kujiajiri. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya.
Tapaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Tapaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali yetu, maendeleo tumeona. Ya ugatuzi ni baraka kwetu, matunda yake tumeona. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi. Nchi ya Kenya imesonga mbele sababu ya uongozi bora. Tunajimudu tukifurahia, uchumi wetu ni dhabiti. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi.
Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Kweli wa Kenya tumebarikiwa na nchi nzuri maridadi. Tutafaulu kuijenga Kenya, tukipanga familia.
Kenya tumebarikiwa na nchi nzuri maridadi. Tunafaulu kuijenga Kenya, tukipanga familia.
Maendeleo tumeyaona na barabara zimejengwa. Watoto wetu sasa wasoma masomo yao, kweli ni bure. Kilimo Kenya kimenawiri na wakulima wanafurahi. Vijana wetu wana ajira, waweza pia kujiajiri. Mimi naomba amani Kenya, ili tuishi kama zamani. Mimi nataka maendeleo yasambazwe kote Kenya. Mimi naomba amani Kenya, ili
of the 4th National Leaders Conference on Population and Development. Ladies and gentlemen, good morning. My name is Catherine Moki. I am the Economic Planning Secretary in the State Department for Planning, and I will be the chair of this morning's session. I want to recognize all of you and to welcome you to this plenary session on the 3rd day of the 4th National Leaders Conference on Population and Development, whose theme is Investing in Human Capital for Achievement of Vision 2030. This conference has brought together leaders drawn from both the national and county level and a cross-section of stakeholders, including representatives of ministries, departments, and agencies from the national and county governments, development partners, representatives of the private sector, civil society organizations, faith-based and community-based organizations, academia and research institutions, experts, among others. For the last 3 days, we have had an opportunity to engage and share information on critical population issues in the country, while also taking into account regional and international trends. The discussions have been interesting, informative, thought-provoking, stimulating, and inspiring. We have shared best practices, learned from each other, and together we have deliberated on solutions to challenges in the area of population and development. Distinguished delegates, as you are aware, the main reference point for discussion in this conference is the draft national population policy, which was developed after extensive discussions with all the 47 counties and key stakeholders. From the extensive consultations and thematic areas, 8 thematic areas emerged, namely, number 1, population size, growth, and structure. Number 2, fertility, including adolescent fertility, family planning, and early marriage. Number 3, morbidity and mortality from childhood to the adult. Number 4, mobility, urbanization, and migration. Number 5, population, human settlement, and environment. Number 6, research, data availability and utilization. Number 7, education and training. And last but not least, number 8, resource mobilization for population programs. The objective of this session this morning will be to share highlights of the recommendations and action points arising from the breakaway sessions that were clustered around the 8 thematic areas. Being breakaway sessions, it was practically impossible to effectively participate in all of them. Indeed, some of us had a difficult time making a decision on which of the sessions to participate in. This session, therefore, gives each one of us an opportunity to be informed, albeit in a summarized way, of the deliberations in all the 8 sessions. To make the presentations this morning are the chairpersons or their representatives of the respective sessions. We have 8 sessions lined up, and each presenter will have a maximum of 10 minutes, and I'll implore upon the presenters to kindly keep the time allocated to them to enable us finish this session within the time allocated. Without further ado, I would like to call upon our first presenter. Just before that, I will read out the order of presentation so that our presenters are ready. The first presenter will be Mr. Ezekiel Ngure, followed by Beatrice Okundi, followed by Dr. Sheila Masharia, followed by Dr. Linda Oucho, followed by Professor Edward Mburugu, followed by Mr. Alois Ratemo, followed by Reverend Canon Chris Kinyanjui, and last but not least, we'll have Honorable David Boni. And therefore, I would like now to invite Mr. Ngure to make the presentation on key recommendations and action points in regard to the first thematic area, population size, growth, and structure. Welcome, Mr. Ngure. You have 10 minutes to make your presentation.
Thank you, Madam Chair, for this opportunity to be able to present what was deliberated during the last 2 days in the thematic area of population size, growth, and age structure. Before I present, I would like to make a point that I'm presenting this on behalf of the various chairs and the various discussants and panelists, and also those people who contributed to this thematic area. And therefore, this was some of the highlights. Otherwise, there's a lot that was discussed, and I'm going to just give a brief highlight of what was discussed and was consensusly agreed upon to move forward this thematic area. This thematic area had 3 sub-themes. One is the population size and growth. The second one was age structure. And the third one was vulnerable population, that is obviously elderly and people with disabilities. And I'll start with what was the key highlight on population size and growth. Throughout the discussion, it was acknowledged that fertility, mortality, and migration are still the drivers of population growth in Kenya. And starting with fertility, the Kenyan past high fertility has created a population momentum that is expected to prevail over the next 50 to 60 years. And therefore, even if Kenya attains the replacement level today of 2.1 births per woman, the country will still experience population growth for several decades because of the momentum, especially for the women within the reproductive age. Within this area, it was also agreed that family planning and education will play a major role in reducing fertility further. And therefore, to ensure that we have population growth and population size that is can be served by the resources that we have, then we need to have investment in family planning and education to reduce further the fertility. And also, as you also realize, is that this is the declining mortality at all age levels. Disparities in fertility, and especially within the counties, has been able to contribute and explain the differences in size, in population size, growth, and age structure among the countries that we have in Kenya. When we look at the mortality, we see that child mortality in Kenya has reduced, and therefore there is in rural areas. But when we look at the urban areas, the child mortality has been seen to, or have been observed to be increasing, and therefore programs and interventions need to be put in place to be able to address this issue. The maternal mortality was observed to have immensely contributed to adult mortality, and therefore the goal to have zero preventable maternal mortality came at the right time, and therefore this is an area that we need to work on if we want to maintain that zero preventable maternal mortality. And again, this also impacted the population size. When we discuss about the impact of COVID-related mortality, we realize that when you look at the numbers compared to other causes of death, and also compared with other countries, it was observed that the impact for now may not be that significant. And therefore, studies and also research need to be done to fully see how much impact it has contributed to the mortality in the country. And therefore, its impact to size, growth, and age structure will not be well understood until this kind of analysis is done. But comparing with other causes of death, then we find that there are others who have higher rates of death. When we look at migration, it was agreed that the net international migration is negligible. And therefore, when we're doing the population projections and other kind of analysis, then we realize that this is not yet, don't have a lot of impact in population size at national level. But the rural migration rural-urban migration has resulted in high population size in some countries, such as we are talking about Kakamega, Nairobi, Nakuru, and the rest. Urbanization, again, cannot be inhibited, hence the urgent need for prudent urban planning. When we look at the age structure was observed to be an important aspect of population planning, resource allocation, because people with different ages in population have various needs. And as we have observed is that population in Kenya, age structure is changing, and it's changing to a favorable situation whereby we can be able to achieve the demographic dividend. Evidence was seen that the population of children under 15 from the last 2019 census is declining, while that of working population, that is 15 to 65, is increasing. However, although the youth are a source of labor supply and critical for achieving the various development goals, a sizable population of Kenya's youth are unemployed. And for now, we estimate that 2.3 million youth aged 15 to 35 are not in education, employment, and training. And therefore, there is need to prioritize interventions in the youth of this age so that we can be able to achieve the demographic dividend. And this is the only time that we can be able to see that we have the benefit of the increased working population. It was also observed that the proportion of elderly persons aged 65 and above is increasing and will continue to increase due to the improving life expectancy. And therefore, programs that are related to health and other issues towards the elderly need to be put into place so that we can be able to address their needs. In the area of vulnerable populations, that is the obviously elderly and people with disabilities, as we have seen is that elderly persons are fast growing, not only in Kenya, but the whole Africa. And you can be able to see that with the increasing life expectancy, there is need to have good social security issues, services, and also other programs that particularly health and also the livelihood of the elderly people be implemented and supported by government so that we can be able to ensure the life expectancy of this generation or this age group continues to increase. The main challenge, therefore, for these elder persons being health, income, and social security, violence, abuse, and negligence need to be addressed at national and also at county level. We also realize that students with disability in the country report higher level of absenteeism in school. And it was also observed that where these children has been given a better environment, they perform better. And for us, therefore, we needed to institute or commence or initiate programs that can be able to address this issue of keeping these children in school and also giving them the better environment that they can be able to be productive in the country. Access to healthcare of people with disabilities is also a great challenge, and due to lack of medical insurance covers, stigmatization by health workers, and also infrastructure and communication barriers. And therefore, programs within this area also need to be improved to be able to cater for these people. And therefore, by the end of the day, they will be productive to the economy. It's therefore recommended that the interventions of social security, social protection, which has positive impact on life expectancy of this vulnerable population, need to be implemented so that we can be able to improve the life of these populations. Lastly, after the whole discussion in this area of population size, growth, and age structure, we realize that this is evidence that needs to be incorporated or integrated in population in planning policy development and any other activities or intervention that's done at county and also at national level. And therefore, we need to have data that well articulate the age structure, the population growth, and the size of the population at national, county, and sub-county level to be able to initiate programs that can be able to address these issues that have been discussed. And therefore, the availability of quality administrative data as a complement to the data collected through censuses and surveys is very critical in population programming at all levels. And therefore, this calls for strengthening of administrative data systems, that is in health, civil registration, and any other administrative data system, so that we can be able to have data quality that can be able to be used in programming at all levels. Lastly, we call upon the counties to be very proactive in collecting, processing, and utilizing data that's needed at the county and also sub-county level, because the planning now is bottom-up. And with this, we'll be able to have enough information and evidence that can be able to have evidence-based decisions at that level. And therefore, we can be able to impact this population size, growth, and age structure within the country. So thank you very much. That's what we were able to discuss, but I know more will come when the report is finalized. Thank you very much, Chair.
Thank you very much, Mr. Ezekiel Ngure, Population Data Specialist at the UNFPA Kenya Country Office, for the good and informative presentation on the key recommendations and action plans on behalf of the breakaway session on population size, growth, and age structure. Before I call the second presenter, I would like to acknowledge the participation of the Chief Administrative Secretary in National Treasury and Planning, Mr. Eric Wafuko, and the Chair, National Council for Population and Development Board, Honorable David Ngugi, who is among the distinguished guests and participants in this particular forum. I will now welcome the second presenter on theme number 2, which is on fertility. And the presentation on behalf of this breakaway session will be made by Beatrice Okundi, Assistant Director, Advocacy, National Council for Population and Development. Beatrice, you have 10 minutes to take us through the presentation. Karibu.
Thank you, Madam Mwoki. Appreciate the opportunity to be able to represent Professor Agwanda in this session. He's held up in a different meeting. So I'll be talking about the second theme, which was on fertility. And this was divided into 3 sub-theme areas. The first one was on adolescent fertility. The moderator was Dr. Isaac Bashir, the head of Department of Family Health at the Ministry of Health. The presenters were Professor Otieno Agwanda from the University of Nairobi, Professor Nduati also from the University of Nairobi, Pamela Onduso, and Dr. Anne Kihara. Pamela is from the Pathfinder International, and Anne Kihara is from the University of Nairobi. Now, this session aimed at to share the extent of adolescent fertility in the country, to also share the effects of adolescent fertility and why the interventions we have in place are not working as expected, and also to share measures that can be used to effectively curb the increasing rates of adolescent fertility. Now, some of the things that came out of these areas in terms of facts is that we have data among adolescents 15 to 19, but when we get to the age group of 10 to 14 years, this group is largely ignored. We have noted that there are limited programming interventions, and adolescents' birth rate is high, especially where poverty rates are also high. Then we have also seen repeated studies showing that for repeated adolescent pregnancies, there's a big impact on human development. And yet, despite what we are getting from the studies, nothing much is being done. The session was also able to say that about 7.2 million births are going to happen between 2022 to 2025. And the interesting bit is that 13% of these births will be among adolescents if nothing is done. Now, in terms of adolescent fertility, what are the key drivers? poverty, drug and substance abuse, sexual violence, and retrogressive cultures, toxic triangle, that is peer pressure and media against the adolescent and young people's lack of requisite knowledge, skills, values, and attitudes to make concrete decisions, and suboptimal parental support. Socioeconomic circumstances that the adolescent face in terms of what their needs are also affect adolescent fertility. Now, we note that Kenya is rich in policies that seek to address adolescent fertility. We have policies that address child labor, FGM, sexual abuse faced by young people. But, and these policies are very important in terms of ensuring free access of maternal health care and adolescent-friendly services. We also have free education systems, among others. Now, the challenge that we are facing is the failure to optimize the brain at an early age as a long-term impact to an individual and the country eventually. When we do not address issues that are impacting on these adolescents, these are the challenges we face. Malnutrition and other threats are serious threats in the childhood and negatively affects the child's development. Adolescent needs good nutrition to enhance their development process. And it is noted that parents have roles to play to ensure teenagers are on course during development. Now, in terms of available opportunities that we have is, first of all, that we need to have a change in the mindset. Adolescent childbearing and its impact reflect a host of many undercurrents. And these are the things that we need to address. If adolescent pregnancy happens, it does not need to become a permanent endpoint to a girl's human capital potential. We also note that genuine human capital concern in the context of adolescent fertility must both reflect on both the mother and the child so that we can begin to break that cycle. We need to reconsider response approach and scope. Now, in terms of other opportunities available, we need to run away with the quick wins already in place. That is optimal implementation of government policies, which include menstrual hygiene, school re-entry policy, 100% transition rate, free primary and secondary education, and integration of pregnant learners. There also needs to be accountability where it matters to parents, government, religious leaders to be able to reduce adolescent fertility. Now, other areas that we need to address is the systematic financial and childcare assistance targeting teenage mothers, their children, and their families. We need also to invest in relevant, timely relevant strategic information and communication advocacy, and empower and/or partnership with adolescents and community to be able to address the socioeconomic concerns that are being raised, like poverty. Some of the recommendation means we need to delay age at first marriage, encourage age-appropriate education, promote training and vocational education, increase youth access to sexual and reproductive health, raise youth voices by involving them in planning and project designs, and think about project sustainability. We need, as a country, to move away from just piloting and leaving projects without completion. There needs to be that sustainability. In terms of ensuring prosperity and posterity, we need to address the needs and be responsive to adolescents, especially the vulnerable and the marginalized. State actors need to be accountable to communities and to the adolescent health. Now, in theme 2, where we're talking about family planning, and we are considering it the best buy for Kenya's development agenda, the moderator was Professor Richard Muga, the CEC for Health in Homa Bay County. Panelists included Professor Murungaru from University of Nairobi, Professor Peter Gichanga, who is the Vice Chancellor, Technical University of Mombasa, and also Principal Investigator for PMA 2020 in Kenya, Dr. Dan Okoro from UNFPA, and Mr. Guillaume Diba from the Family Planning 2030 Secretariat, Global Secretariat. Now, this session sought to be able to elaborate on why family planning is considered a best buy for Kenya's development agenda. And we also needed to discuss the importance of addressing family planning concerns for users and the need for domestic financing of family planning. And we also sought to recommend measures that the policy can adopt to address the challenges facing family planning services in Kenya. Now, in terms of just giving a bit of background, family planning should be looked at not just as a method of limiting birth, but spacing, so that we can be able to advocate for it and be able to include it in our public education. It is important for education culture, government policies, such as provision of family planning to influence fertility. And we have noted that because of the programs we've had in the country, we've been able to reduce our fertility rates from about 8 children on average per woman to about 3.5 as per our last, in fact, not just 2014, but even the census report. Now, what are the facts around family planning? It is referenced to be developed in the development process. It is seen as an indicator for employment, education, consumption, transport, and communication. There exists a complex relationship between population and development. Development is expected to result to slow growth of population in the long term. Where we have large population, it results to big families, and this inhibits development of the country. Further, we note that demographic transformation in Kenya is key, hinders to realization of meaningful development. And that's why we are thinking family planning strategy would be able to provide a favorable demographic transition to ensure that we are able to reduce fertility and mortality. And we know that both maternal and infant mortality are high in counties that have shown low prevalence for family planning in Kenya. We need to promote the promotion of women education, reduction of maternal and child mortality, and eradicating cultural practices are among the strategies for promoting the use of family planning. Now, other facts include physical facilities, availability of health workforce, myths and misconceptions that are some of the concerns among users, which lead to discontinuation and consequently low uptake of family planning. We also noted that only 6 counties out of the 47 have met the recommended target of healthcare workers per given population. Further, the low socioeconomic situation in some counties create an unfavorable environment for family planning, and family planning can be enhanced through promoting education of women and reducing child mortality. We need to utilize the existing research findings to formulate and implement socioeconomic and other interventions. We need to mainstream monitoring and evaluation and research in the family planning interventions so that we can promote family planning for development. We note that some of the challenges that we are facing and even be able to give recommendation is stockouts for different methods still exist at the facility level, and they're majorly associated with supply chain hitches. Financing of family is largely dependent on out-of-pocket expenditure and donor funding. Domestic funding is among the high impact intervention that the country should be able to explore. And this is not just for the government, but you also need to include private sector financing. Myths and misconceptions, as already indicated, has contributed to low family planning use. And we note that further that only 59% of our health facilities have the right infrastructure, medicines, and personnel to be able to accommodate family planning. So we need to work in those areas. The disparities witnessed in uptake among counties, we need to find out what are the interventions that we can be able to put in place to be able to address, to ensure that we are all moving as a one population. Some of the things that we have noted as that family planning, why family planning is important, it has the highest benefit cost ratios among a wide choice of policy options for development, social and economic benefits for women, their families, and society. In health, prevention is much better than treatment. We note that the cost of modern contraception is much lower than providing care for unintended pregnancy. Suboptimal engagement of community and the private sector becomes important here. Social cultural barriers, myths, and misconceptions will need to be addressed. We need to stop operating as silo programming and ensure integration with other population programs, ensure commodity mix and shortages are addressed, and also be able to involve the male. Cultural issues should be addressed, and the dilemma among the teenagers on whether to use or not to use contraceptives should be addressed. We also need to look at the suboptimal quality of care as far as family planning is concerned. Some of the policy recommendations that were given is that family planning should be used as a driver of sustainable development in Vision 2030 development blueprint. integration of family planning beyond the health sector, and promoting male involvement and participation in family planning. We need also to have a method mix and commodity availability in service delivery points. Now, other things noted is that we need to increase integration of family planning, HIV and AIDS services, reproductive health, among other health services. We need to sustain domestic financing and ensure we are addressing the gender imbalance. Strong partnership with development partners would also help, and total market approach so that people who can be able to afford can be able to access, and those who are not able to afford can also still get the same services. We need to adapt our service delivery, ensure health insurance to cover family planning, both at NHIF level and in the private insurance. Now, further, we need to engage policymakers on family planning issues during population and development discussions and ensure that we can be able to use innovation and technology in service delivery. The third sub-theme was on marriage, and it focused on child marriages in Kenya. Now, the chair of this session was Professor Onyango Uma from the University of Nairobi. The presenters were Professor Ikamari from University of Nairobi, Ms. Murgo from UNFPA, and Dr. Kangwana from the Population Council. This session sought to discuss marriage as a determinant of fertility, to share the challenges of early marriages, and to discuss tangible interventions to eliminate child marriages in Kenya. Now, the fact remains that marriage remains a key determinant of fertility in the country. We note that on average, age at marriage for those who have ever married increased by 1 year for males, from 26.7 to 27.3 by the year 2019. And for the females, we only noted a 0.5 years increment from 22.5 to 23.1 years by 2019. The government has always been keen on reducing adolescent birth rates. Thus, they've made the legal age at marriage to be 18 years for both boys and girls. Now, the other facts are that the main consequence of child marriages is the continued early pregnancies and childbearing. We note that the prevalence of child marriage in the country is at 23%. It is higher in the rural areas at 29% and 17% in the urban areas. Despite all the legal pronouncements we still have, people are still marrying at below the age of 15, and it has not reduced since the 1990s. And it remains at 4.4% using the data from the Kenya Demographic Health Survey of 2014. Now, why do we focus on child marriage? Child marriage is a key indicator of fertility. It's a violation of human rights as there's no freedom of choice and consent, and some are even forced into marriage. There are negative health impacts, complications during pregnancy and childbirth as a result of these child marriages. And we note that child marriage is enshrined in various international conventions and agreements, and it is critical to aid sustainable development goals. Now, in terms of child marriage has been pronounced at 23% for girls, and that's why we focus on the girls, but among the boys, it's just 2.5%. Education attainment and poverty differentials also play a key role in child marriage's prevalence. We note that there are regional and county differentials as far as child marriage is concerned. Nairobi and Central have low levels when we compare that to northeastern Kenya, Nyanza, and the Rift Valley regions of the country. Now, in terms of challenges, inadequate implementation of the laws that exist, both at the national and the county levels. During humanitarian risks like the COVID-19, we've seen a lot of child marriages, risk of increasing mortalities for the child and for the mother, loss in education attainment. It impedes the efforts to end poverty and other forms of deprivations. It also puts them at the danger of gender-based violence, and the cycle of poverty continues as a result. Now, some of the interventions I shared was that we need to work on violence prevention, we need to ensure education, and we also need to impact on it in terms of how do we get health involved and wealth creation to be able to reduce on child marriages. Thank you very much.
Beatrice Okundi, Assistant Director of Population, National Advocacy, National Council for Population and Development. Thank you for giving us a clear and detailed and informative presentation on the thematic area of fertility. Going forward, I want to kindly request the presenters that are coming next to please just present the highlights of the breakaway session, the key recommendations and action points. The details will be in the report that will be shared with all the participants. So for us to keep within the time allocated to us, kindly only give the key highlights. Our next presenter is Dr. Sheila Macharia, a public health expert, an independent consultant in health policy and strategy, and she'll be making a presentation on behalf of the breakaway session on morbidity and mortality. Karibu, Dr. Sheila Macharia. Please work within the 10 minutes provided. Thank you.
Good morning, ladies and gentlemen. I'm not able to see myself on the video, so I'm not sure whether you can see me. Can please, would the administrator please open the video also?
Sheila, I think you say you can't see yourself in the video. We can see you clearly.
Thank you. That's all right. Then.
All
Maybe
right.
the problem is on my end. All right.
Okay.
All right. Good morning, ladies and gentlemen, and thank you for the opportunity to present the key highlights on morbidity and mortality. I'd like to start this session by thanking the presenters who made very excellent and high-level presentations that are so important at this time under this topic. For childhood morbidity and mortality, the moderator was Honorable Dr. James Nikal, and the panelists were Dr. Ancient Kituku, Dr. Wangari Ng'ang'a, and Dr. Laura Oyengo, and we thank them very much. For the morbidity and mortality among adolescents and young people, which I moderated, I want to thank Dr. Christine Wambugu, Dr. Ruth Libon, and Honorable CEC, Mrs. Ruth Koech. And then finally, for the adult morbidity and mortality, which was facilitated or moderated by Dr. Mohammed Sheikh, I would like to thank Dr. James Kitonga, Professor Alfred Agwanda, and Dr. Duncan Kibogon. Thank you very much. So without further ado, let's move to the first slide. The importance of this session cannot be underrated, because we know that poor health poses significant threats to our economy, and that there seems to be a shift of global health burden towards non-communicable diseases and injuries. And of course, now we have COVID-19, which is very new for the world. And we are still at the point where, especially in this region of Africa, the communicable maternal nutrition and neonatal conditions still persist. And so it is critical that we understand any variations that have occurred in the past and currently in the present and going on to the future. Next slide, please. So under these three topics, we'll be looking at the issue of children, the issue of adolescents and young persons, and of course, adults. Next slide, please. Next slide. So the key highlights about child health is that largely the things that are contributing to mortality and mobility amongst children are preventable to date. Stunting is still a problem, and especially in 15 counties in this country. And that the neonatal deaths still present a challenge. So something new that we also need to recognize is that injuries are beginning to be something significant for children and generally for those aged less than 20 years. At the same time, although government does invest very heavily and the counties are putting their resources, we recognize that in the health areas that pertain to young people or children, we have development partners who are supporting a slew of activities around the country. So the takeaway here is that things that are affecting our children are preventable. And that secondly, that we still have high partnership from donors. And this is something that we need to look at, which in terms of sustainable financing for children. And we have the opportunity under the Universal Health Care Program. Next slide, please. And so after a lot of discussions about the things that are affecting children, there's a realization that what is needed critically is to expand the implementation of the high impact practices which are known. It's not that we need anything new. We do have existing government programs and they're listed there, including the ongoing polio campaign that we have. And so what needs to be done is that across the country, we need to track the progress on these interventions, but more importantly, to track the outcomes of health for children. And the way to do this is to strengthen the partnerships that exist in the strategic technical working groups and to use lessons learned from one county to the other, because you have centers of excellence and a point of exchanging lessons. But more importantly, we need to use data to understand regional variations so that all the approaches for children are context specific. And finally, that we need to look at the issue of caregivers and get to the household and realize that there is a lot there that can be changed, that if we change there, there's a lot then that improves the circumstances of children. They are a critical population for the future of this country. Underpinning all that is health system strengthening, and the pandemic has shown us that no country in the world had such robust health systems that they could manage the pandemic. So how much more in our context, especially in child health. But again, a focus on using evidence and looking at outcomes for children. Next slide, please. For adolescents and young people, they still constitute a significant part of our population, although as we've seen earlier, the elderly are increasing in Kenya. And you can see the mortality rates there for the different age groups. We definitely have what I would call a dearth of policies and guidelines for this age group, but with very weak dissemination. They are present here in the national level, and people come for meetings and hear them for the first time. COVID-19 has exposed new risk factors as a result of young people being out of school and poor socioeconomic status in household. We began to see that homes were not very safe, and there's drug and substance abuse, there was emotional violence, sexual violence, and then the risky sexual behavior that culminated in the teen pregnancies that we have seen that have afflicted the young people. Nutrition is still a risk, and that has two ways. There's the undernutrition, but we're also increasingly seeing obesity in some of the high socioeconomic settings and in urban areas. HIV remains a burden amongst young people and a real concern. And we recognize also that health data for this group is not yet nuanced enough for us to make very good decisions. So something that we need to think about across the board from national to county level. Next slide, please. The causes of morbidity and mortality for boys and girls differ. And for young men, we are seeing increasingly that injuries are becoming a significant factor together with parasitic infections and skin infections. And for girls, it remains HIV and maternal and newborn health, which is means that we must approach this demographic very carefully. COVID-19 has highlighted the need to focus on mental health because we have seen depression and stress amongst young people. And I referred to gender and sexual-based violence that was highlighted during COVID as a pandemic, actually, even around the world, and affected these young people. We have referenced data. And so we need to recognize that the use of estimates is not helping us. And there's need to address this gap, expand the data that's available so that it's detailed enough, and then that we should focus all the programs that we're doing on outcomes. Multi-sectoral approaches are key, and they must be context specific. As CEC Ruth Koech said, there are differences not only between counties, but even within the county. And therefore, any program of health across all demographics has to be pertinent to that particular village, community, sub-county, etc. It's a fact that when you look at health resources, they seem to be largely focused on what we'd call adult health. And so counties now need to allocate specific county resources for adolescent and youth programs and be able to track the expenditure on those if we are to make a difference. HIV continues to stare at us in the face, and the fact that a third of new HIV infections are among adolescents and youth is a real concern, because this demographic are our future. And then something that we must recognize that was brought up by Dr. Libon for the CEC for NAC is that as adolescents transition to adulthood, they then pick up other morbidities. So they get NCDs like hypertension or diabetes, and now you have a complex problem. And we've realized under the pandemic that those with existing morbidities are more vulnerable to this pandemic. So we need to look at adolescents, not at one point in time, but as a continuum. And then we cannot emphasize enough how much policies and strategies must cascade to every county so that they can be translated in a context-specific way. Next. As I begin the adult morbidity and mortality, it would be remiss of me not to mention that we need to place adolescents and youth at the heart of whatever it is that we're doing. We need to have real representation of them, not tokenism, but real representation. Now with adults, for women, the maternal conditions continue to be the leading cause of death, and for men, it is TB. Again, if you look at that, these are conditions largely preventable and not complicated to address. Then for older men, we are seeing that it's stroke, and for females, ischemic heart disease. And we've just heard that the elderly population is growing. So it means that that focus on NCDs is really critical in our health system. An unfortunate finding is the road traffic injuries. And you can see the numbers there. This is something that really must be addressed because it can be addressed. It's not an impossibility. But when you look at our roads and you look at the borders, you look at the matatus, you look at the breakdown of law, it tells you that there's not yet enough attention. And so we can really reduce mortality and morbidity if we just pay attention to these. However, majority of the preventable deaths are maternal deaths. And we still have the age-old issue of the 3 delays. Delays in making decisions at home, delays in accessing, and delays in receiving healthcare. So there's a lot of behavior change there that is needed, a lot of addressing what is happening at the home and the community. And therefore, primary healthcare approach becomes really critical going forward. Next slide, please. And so if we look at the key actions there, we still need to examine the social cultural values, attitudes, and behavior that relate to saving women's lives. The issue of gender is so critical, and decision-making. And for communities to prioritize that and to put their best efforts towards that. And for that to happen, there needs to be working with stakeholders that go beyond the women, the cultural leaders, the community leaders, the political leaders, the private sector, the faith-based sector. All of these groups must work in tandem. And we should be very careful to begin to examine the data so that we are not having a widening sexual differentials with regard to mortality. But at the same time, what we are saying is that if we are looking at men and you're beginning to see more of the NCDs, then let's purpose towards that and the injuries. Yeah, women, if it's the maternal health and HIV, then let's work towards that. And we need more studies to guide how health insurance could determine the annual premiums, because many of these conditions and situations also arise because there's a financial barrier to accessing both preventive and curative and promotive health services. At present, with the changes the dynamic changes we have in our populations, we do need studies to examine the socioeconomic factors that are contributing to all of the things that we have talked about, whether it be the road infrastructures and that interferes with people accessing healthcare, whether it be the road traffic accidents, the behaviors that we are seeing that deter people from seeking healthcare, or that continue to lean towards some cultural practices that do not favor women. and also the situation that bars them from accessing healthcare. These are all areas that still need a lot of research, but it has to be context specific. And then, because self-harm is actually something that's beginning to be a concern, and mental health, that needs to be pronounced in whatever work we'll be doing in the health program and across society moving forward. Thank you very much, and I'll hand over to the facilitator.
Thank you very much, Dr. Sheila Macharia, independent consultant in health policy and strategy, for your very clear, precise, and detailed presentation on the theme on morbidity and mortality. I would now like to invite the fourth presenter, Dr. Linda Oucho, Executive Director, African Migration and Development Center, who will be making a presentation on the theme on migration, mobility, and urbanization. Welcome, Dr. Linda Oucho.
Thank you very much for this opportunity to present on this thematic area. I'll try to not take too much time. Just give me 1 second, I share the PowerPoint. So I'll be summarizing the presentations that were made from 3 thematic areas under migration, mobility, and urbanization. The first thematic group was on mobility and internal migration, where we had 3 speakers. I'll come to the presentation shortly. And the second panel, which I participated in, was on international migration. And the third thematic area was on urbanization. All these topics are quite interconnected, and it's quite important for us to consider the importance of migration in the population dynamics. So in terms of sub-theme 1 on mobility and internal migration, we had 3 speakers, but just to remind you that the session was actually looking at the changing migration patterns and drivers of migration, looking at the availability of data and information on human mobility on migration, and enhancing our understanding of the growing complexity of mixed migration patterns that take place within Kenya or through Kenya. And our first speaker was actually Ms. Mary Muyonga, who was looking at strengthening internal migration data. She is the coordinator she's a coordinator for the evolution study under World Bank. And some of the highlights that she mentioned was that youth are the main contributors of migration, or the main actors of migration, with a peak age of between 24 and 29. The counties that actually attract or continue to attract migrants from other counties in the coastal region, central region, Rift Valley, and Nairobi, and at the same time, we also see a lot of negative net migration. That is now people moving out of those counties in northeastern, eastern, and western and Nyanza region. These are historical areas of rural urban migration that have existed even prior to independence. And these migration patterns continue to exist today. And the main drivers of migration that she mentioned were political, environmental, economic, and social and demographic. And when you look at the situation in Kenya, you can actually see the flow of people between counties, even more recently with the COVID-19 pandemic. She highlighted some of the existing legal and institutional frameworks that actually facilitate or impact those who are moving internally. These include the Registration of Persons Act, the Kenya Citizens and Foreign Nationals Management Service Act, the draft National Migration Policy that is currently being developed, and the Data Dissemination and Access Policy of 2013, Statistics Act, and Counter Trafficking Persons Act, as well as Access to Information Act. These frameworks are quite important, especially when you're looking at data collection in terms of the people you need to capture in terms of data, either in the census or surveys that are taking place. And they're quite critical for guiding different actors to undertake their activities. She actually recommended for strengthening of internal migration that we need further analysis and disaggregation of existing data. Although our census captures internal migration within the country, it's not disaggregated data. So there needs to be strengthening an analysis of the disaggregated data. But also data sharing must be critical among stakeholders because there are different data collectors that actually capture the different data sets. So there needs to be a platform where information can be shared and utilized by different actors. It's actually very critical also to finalize the Kenya migration policy, national migration policy, because within that there is a priority area on internal migration, which gives guidelines on what we need to do in terms of internal migration in general, which includes strengthening of data collection practices. But there's also a need to establish a migration unit within the national statistical system. And these are discussions that are taking place within the development of this Kenya national migration policy. Furthermore, there's actually a need to mainstream migration in development plans at national and county level. And this we have been seeing in terms of discussions on how the GCM, that is a global compact on safe, orderly, and regular migration for that was actually signed in 2018 by different member states that will guide different countries on how to ensure that they understand their migration patterns and actually include them in their development plans. But also there's a need to conduct migration surveys after every 5 years. Currently, the migration data is captured in the census, which takes place every 10 years. Then we had a presentation from Dr. Luchetu Likaka from African Nazarene University, who was tackling the complexity of mixed migration, human trafficking, and smuggling within the context of Kenya. And some of the key highlights he mentioned is that migration contributes to development and poverty reduction. So there's always this positive impact that migration has, but we need to recognize that mixed migration takes place within the country, and mixed migration includes irregular migrants, that is people who are traveling, who are being trafficked or who are being smuggled through Kenya or from Kenya. There's also refugees and asylum seekers. Victims of trafficking also fall under irregular migrants. We also have stateless persons and unaccompanied minors and separated children with other vulnerable persons who are moving. I think the most relatable vulnerable person that you can look at are the people with disabilities coming from Tanzania. And Kenya is actually a route for both legal and illegal migration from Somalia and Ethiopia, those who are bound for South Africa, that's the southern route. And then there are those who actually also move to Europe and the Americas using different patterns, mostly by road and by sea for those who are going to the Southern African region. So it's important for us to understand the different ways in which different migrants move through the different countries. So Dr. Luchetu actually recommended that there's a need to foster collaboration between partners working across the migration sectors. And this includes people who have either a direct or indirect link with migration itself. They need to learn from the community structures which support the socioeconomic integration of refugee and migrant communities. There's ongoing research, but I think there's more to learn from that aspect of the community structures. There's also a need to improve coordination between government, NGOs, and civil societies. He also recommended the need to implement the objectives and actions of the Global Compact for Migration, known as GCM, that was adopted by Kenya. And at the moment, Kenya has a plan for implementing the GCM for the next 3 years. There's also a need to increase awareness campaigns, trainings and law enforcement efforts related to irregular migration patterns. This also includes increasing investigations, prosecutions, and convictions of trafficking offenses. There's also a need to ensure protective services are available to adult trafficking victims so that at least they feel that they are protected by the system. And this requires us to understand what kind of data we have. So there's a need to increase data collection and sharing among relevant agencies that work in this area. Finally, there's a need to strengthen coordination between government agencies, which I believed I mentioned earlier, but this includes across at the county level and national level. Then we heard from third speaker, Engineer Francis Gitau, who's the AG Director General for NAMATA. That is the one that is taking care of the transport for Nairobi metropolitan area. And he was more focused on the opportunities and challenges and lessons learned in designing motorized and non-motorized transportation. So looking at mobility within Nairobi County. And within this, he recognized that since independence, over 1,811 kilometers have been paved across in Nairobi. 1,811 kilometers to 14,000 kilometers have actually enabled movement, and they've been paved. This is the length of road that has been paved in Nairobi. The focus has mostly been on motorized transport, and very little attention has been paid to non-motorized transport. That is like people moving on foot or even on bicycle. And we have seen a growth in cities, and this is important because as our population grows, it needs to match the public transport facilities and services that take place. And at the moment, this is, as we have seen more recently, this has been changing in the past couple of years. Therefore, he actually highlighted there's an urban sprawl to the secondary towns which presents opportunities and challenges, because we have a lot of people living in Kiambu County, in Kitengela, in Ongata Rongai, that all move between the two counties for purposes of employment, trade, or other businesses. And this is important for us to actually strengthen the road network so that at least people can move around easily, and this includes looking at the non-motorized transport. The second thematic group was on international migration, where we had also 3 speakers. And this session was just to share different forms of international migration and provide drivers of international migration and identify opportunities, challenges, and lessons learned in terms of international migration. We heard from Ms. Pravina Gurung from IOM, who's a program manager, who was talking about enhancing safe and orderly migration through implementation of the Global Impact Compact of Migration. She highlighted that the GCM is a cooperative framework that comprises of 23 objectives for safe, orderly, and regular migration, which are embedded in the SDG number 10.3 actually. And she recommended the need for us to implement the GCM National Action Plan, ensuring that the whole of governmental approach and the whole of society approach is adopted when trying to mainstream migration into the national development plans. But we also need to ensure that migrants are not left behind in terms of the mainstreaming of the migration process into the national development plans and sectoral plans and policies. These are quite critical for us, especially going forward in terms of harnessing migration for development purposes. She also recommended the need to combat trafficking and smuggling and to promote protection of victims, just as Dr. Luchetu had mentioned earlier. Because as much as people may be moving in and out of Kenya in a regular way, we do have cases of people who move irregularly within the country. There's also a need to mainstream diaspora into national development programs to contribute to both host and origin countries. But also we need to reduce the drivers of migration, especially for those who related to climate change, which is a growing issue as we have seen in recent years. But finally, we also need to promote regular pathways for migration in order to ensure that people are migrating with the right documentation, they're not in positions in distress, and they're able to harness the benefits of actually being a migrant in a different country. Finally, and my presentation was focusing on the benefits and challenges of international migration. Where in my presentation, I looked at Kenya as an attractive destination for international migrants from the continent and beyond, but also we have the diaspora who go outside to acquire skills or jobs that will actually contribute to the development of the country, either directly or indirectly. I mentioned that international migration contributes to economic development and growth in various ways, but we don't have a lot of understanding how international migrants, both immigrants and diaspora, change the way sectors operate, and how skills are transferred and contribute to human development. So expanding our understanding that international migration can also contribute to human development, but sharing the knowledge and data on that aspect on international migration. Finally, we heard from Mr. Joseph Njue, who's the AG Director of Labor Migration under the National Employment Authority called NEA. And he was highlighting addressing unemployment and facilitating employment through foreign employment and placement. So looking at those diaspora that are going outside for employment purposes. And he estimated that their number of Kenyans in diaspora is about 4 million, with 200,000 working in the Middle East alone. There's a management and administration system of foreign employment in Kenya, which entails one, pre-departure training and orientation prior to leaving the country, regulation of private employment agencies, development of home care management curriculum, along with the Kenya Labor Migration Information System that is operational on the NAIR website. He also highlighted that Kenya has a high number of unregistered employment agencies compared to other East African countries. These are the private recruitment agencies that are offering opportunities for Kenyans seeking employment abroad. And currently there are two associations of recruitment agencies that are recognized in the government of Kenya. These are the Kenya Association of Private Employment Agencies, known as KAPEA, and the Association of Skilled Migrant Agencies of Kenya, known as ASMAC. Finally, we have the third theme of urbanization, where the objectives of this session was to provide opportunities and challenges, as well as lessons learned on urban planning in Kenya. Obviously, also considering the importance of migrants moving in and out of urban areas, provide recommendations on sustainable urban development and planning, as well as share information on market trends, best practices, optimal areas, and risk assessment on real estate investment. And within this session, we heard from Mr. George Wasonga, who's the Chief Executive Officer of Urban Development Platform, and he spoke about the sustainable urban planning and development, looking at the waste management system in the urban areas. Within his presentation, he highlighted that within the World Cities Report of 2020, there are 5 values of sustainable urban development, and these are urban diversity, goods and services, resource efficiencies, cities for all, and sound institutions. What he also highlighted is that we need to recognize the waste scenarios in Kenya in order for us to respond effectively to the urban needs. So he highlighted that the 60% of waste is organic, and about 22,000 tons of waste is generated per day, and that is about 8 million per year. 40%, that is 3.2 million tons of the total annual waste, is from the urban areas. So this is quite critical for us to understand what this means in terms of waste management and whether the services that we have currently are sufficient to handle the growing waste issue that we have. Finally, he highlighted that there's a 40% of the urban residents that receive waste services. How do we now increase those waste services so that we don't have an increase in numbers of waste per year? And with that, I believe I end my present. Oh, sorry, there's one more. There's also Mr. Wafula Nabutulo, who's the chair Building Surveyors Board, who actually presented on real estate investment, market trends, best practices, and risk assessment for enhanced return. So looking at the real estate in Kenya within the context of urbanization. And he highlighted that real estate is a critical driver for economic growth. And we've seen a lot of development in terms of houses, apartments in the past couple of 10 to 15 years. And there are 2 types of real estate. There's the improved and the unimproved, which are quite self-explanatory. But we also need to recognize that the real estate includes those that are residential, where people live in different communities, those that are commercial for businesses, and those that are industrial for producing different resources and products. And within the Big Four agenda is predicated upon availability and affordability of real estate. This is one of the Big Four agendas, which is affordable housing, that has been the target for the past 5 years. And what he recommended is that we need to create other urban centers like Tatu and Konza City to decongest major cities. And we've seen that happening with others like Tilisi. But how do we expand that in different areas, in different counties? There's also a need to anticipate urbanization trends for proper planning. And we need to ensure that we understand what these urbanization trends are and whether we have sufficient data to actually do that. But we also need to create good connectivity to decongest the major cities. And I think this has been happening a lot with the road transport that has actually been taking place for the past couple of years. So thank you very much for listening, and I hand over to the facilitator, and I hope that we'll be able to get some solutions to this. Thank you very much.
Thank you very much, Dr. Linda Oucho, Executive Director, African Migration and Development Center, for your presentation on the theme Migration, Mobility, and Urbanization. Dear delegates, I'm sure you recognize that for each theme, there are several sub-themes, each with its own highlights, recommendations, and actions. And therefore, it is really difficult to keep within the given allocated time of 10 minutes. However, I continue to implore upon the presenters to try as much as possible to just give the key highlights. The next presentation, the fifth one, will be by Professor Edward Mburugu, Professor, Department of Sociology, University of Nairobi. And Professor will be making the presentation on behalf of the breakaway session on population, human settlements, and environment. Karibu sana, Professor Edward Mburugu.
Thank you very much for that introduction. And I must also take a chance to thank all the moderators and the panelists who participated in this discussion. Now, the topic, in the interest of time, as you have already alluded to, I'm not going to use the PowerPoint. I'll just point out the major areas of concern and the issues that around which the findings and the highlighted point that we made should be coming up. Now, the central area of focus is population, human settlement, and environment. Now, in this focus area, there are sub-themes. The first sub-theme had to do with population and environment. The second sub-theme focused on population and human settlement. And the third sub-theme focused on risk response. Point of note here is that the environment dictates the type of enjoyment people find as they continue to inhabit the areas they occupy. It was pointed out that the major factor in human settlement and environment is population growth. It's through population growth, which is high and continues to be high and is likely to progress on given the population momentum before it begins to slow down. We are going to experience pressure of numbers of people in both urban and rural areas. In particular, the urban areas possess 35% of Kenya's population, and the rural areas, the rest, 65%. In these urban areas, the torrent of migrants is immense in Nairobi and all other centers, major towns, major cities. And in all these areas of urban areas is overcrowding and urban sprawl, the spread out of population to the suburbs. And many of these suburbs occupy fertile areas, agricultural areas, which are taken up for housing and other development of institutions and housing estates and so forth. And all that endangers food security because agriculture cannot anymore progress in these areas. Now, we note that also in rural areas, there is fragmentation of land due to population numbers, as each family member requires a piece of land of the ancestral place. This cannot continue given the high population growth. There is also in rural areas irresponsible use of resources. And given the high population growth, the numbers of people and families involved are endangered in terms of quality of life they need to improve upon. Also, it was noted that 80% of Kenya's land is arid and semi-arid. And most of it has a very low carrying capacity. And given that, there needs to be prudent use of resources. And the fact that in these arid, semi-arid areas, where the pressure of numbers, especially from potential agricultural areas, which are increasing in to ease out that population, they take up those arid areas, not so much to develop them for productive use, but just to get a space to occupy. And that in itself is a practice that cannot continue. When land is communally owned, and it implies that the land tenure security is endangered as well. So it is also noted that the 20% of the arable land, which possesses close to 75% of the population, is also aggravated by overgrazing, overstocking, and climate change. And all that leads to drought, high temperatures, and also high temperatures that are not conducive to vegetation. And it means that then that we need to take great attention to population growth, especially in the 20% area of Kenya that possesses 75% of the population. And as I end, I might point out that in each of these areas, we'll come up with the findings and the highlights of major recommendations and the policy actions that need to be given attention to. Thank you very much for that.
Burugu, Professor, Department of Sociology, University of Nairobi, making the presentation on the thematic area of population, human settlement, and environment. I want to thank you for a well-articulated presentation, precise, and I also want to thank you for keeping within the time given. I would now like to invite our sixth presenter, Mr. Alois Ratemo, my colleague, Director, Monitoring and Evaluation Directorate, State Department for Planning, to give the presentation on behalf of the breakaway session on research, data, and innovation, ICT. Welcome, Director Ratemo.
Thank you, Madam APS, who is our moderator today. Good morning, colleagues. Let me also take this opportunity to make a presentation on behalf of my colleagues who are in thematic area number 6. We had 2 sub-themes. The first sub-theme was data and research. The second sub-theme was on innovation and the data availability. Also, at this juncture, it's important to appreciate and acknowledge our co-chairs. The first theme we had Senior Director Waweru Kamau, Director Social and Governance Directorate in the State Department for Planning, who was ably assisted by Madam Angeline Sipalo, I was chairing or moderating the second sub-theme. Having said that, Madam, you can also allow me kindly to acknowledge the panelists. In the first sub-theme 6.1, we had Bol Ngugi, who is the manager from KNBS. We had Jaraba Ben from the University of Nairobi. We had also Ancherin Sparrow, the Senior Country Director, Population Reference Bureau. We had also Frederick Otieno, who was the Population Data Advisor, UNFPA. In the second sub-theme, we had Lilian Kimeto, Deputy Director, Head of Communication Sector. We had also Immaculate Kasaiti, she's the Data Commissioner, Office of the Data Protection Commission, and Dr. Damaso Kadanje, the Head of Data APRSG, with Joy Kiiru, the Policy and Research Advisor, JPOL. Having said that, I expected my team to project my presentation. Irene?
Director, you can just start.
Yeah. Thank you, Madam EPS. You know, I expected our team on the ground to do it, but let me proceed. For the purpose of this team, members acknowledge that our government recognizes the importance of data, and the data we are talking about here should be quality, reliable, timely data, which can be used in informing policy decisions. The next slide, please. Next. Yes. Also, we are also saying that there is need for quality data. Quality data will be useful in terms of establishing the evidence-based decision-making. We are focusing on issues to do with the national policy on population. We are also implementing the Kenya National, the Vision 2030. We also need some quality and timely data. Also, we are a part of the global village, which is also implementing the Sustainable Development Goals. We are saying that we need also this data to assist us to track the implementation of these goals. The same also applies with the ICPD 25 Nairobi Summit, where we made 17 commitments, and we need high quality data, which can also assist us to ensure that we are on track in terms of implementing these 17 commitments. However, the team also acknowledged that we have got some gaps in terms of managing this data, gaps in terms of developing the data, cleaning it such that it can be useful in making decisions. Next slide. Next. Already I've acknowledged the colleagues who participated in these sessions. Yes, the issues which we picked from the first sub-theme is that everybody was in agreement that the government recognizes the need for population management for sustainable economic development. This is something which you cannot ignore, and therefore we need availability of timely, reliable, and quality data. Also, the team appreciated that when you compare Kenya with other countries, we have got what we call the modern statistics. Colleagues, you are aware that the Statistics Act of 2006, which was amended in 2019, it's one which is really guiding us on how to manage data in this country. You can't compare this one with some other countries. Also, the team acknowledged that when you talk about research institutions in this country, these are the best in terms of issues to do with population and development. Number of surveys have been undertaken for the data from civil registration, vital statistics systems. The issue now we are grappling with is issues of quality and timeliness. Also, we appreciated the fact that the accessibility by all potential users has been a key challenge. And that's why you realize that as we continue discussing, we realize that the issue of technology now comes at the fore. How do we embrace technology such that we can be able to get data in real time, but the data should also be complete. Also, we are saying that we've said that we need this data to be tracking our blueprint and including the SDGs and the 17 ICPP commitments. Next. Also, under theme 6.2, there was this discussion where we felt that still access to research data from different actors has not been as easy as we may think. Therefore, these are the issues which we need also. By the end of this conference, we must come up with strategies on how we can be able to ensure that at least data which is there is accessible. Of course, we have appreciated that we are advanced in terms of Statistics Act. We are doing well, but still there were some issues to do with accessibility. And also, how about the resources? Do we have adequate resources? We need budget for us to get this data. And when you've gotten this data, to clean it, and how do you share this data? How do you disseminate it? These are the issues which I think we should be thinking as a country and come up with strategies on how we can be able to undertake them. And of course, you've talked about technology. Technology, we are saying that we should be innovative. We should have real-time data. We should have data which is useful to aid decision making. Next. Now, which are the recommendations which the teams felt that we should think and discuss? We are saying that the resources, we need more resources for population and development. There was some observation that over the years, the resources dedicated for P&D have been going down. But it's high time when you think about population and development in this country, it's a driver. When you talk about the Vision 2030, when you talk about the Big Four, when you talk about SDGs, any blueprint, there is this population behind it. Therefore, we need more resources. Come up with strategies on how we can be able to mobilize resources to assist in implementing activities under population and development. Also, we propose that we can also try as a country to make use of the Addis Ababa Declaration of Population and Development Framework to aid in data generation and utilization. Since we have got challenges to do with the data, also there is need for us to ask ourselves how we can be able to identify the data gaps, disaggregate them so that we can be able to have data which is useful. Also, issues to do with investment, a lot of investment in data management and technology, I've alluded to that. There is a need also to improve coverage and harness data from administrative systems. Also, we have got the Data Protection Act of 2019. We were informed that it's being operationalized by three regulations, but the team felt that it's important we fast track because it's important to ensure that the data which we get, whoever is going to supply this data, if they are assured of privacy as articulated in the Constitution Act, the Constitution Article number 31, then it's important for us to start operationalizing this act. Thank you. Let's just move to the next slide, kindly. Next. We've talked about investment, therefore you appreciate that the team felt that we need more resources, and these resources should go towards how do we manage data, technology, how do we ensure that we have what innovative ways of producing this data real time. Also, there is this issue of capacity and resources. How do we strengthen this capacity? The team felt that we should also be looking at capacity at all levels. We are looking at the national level without leaving aside our county colleagues. We've said that we should also embrace technology. And also we are saying that moving forward again in terms of resources, then we should also start embracing partnerships, collaborations, and networks so that we can be able to mobilize more resources which can be able to assist in P&D. Next. Yeah, thank you, Madam EPS moderator. I think that's what we were able to share, but the details will be shared by our coordinators. Thank you so much.
Lois Ratemo, Director Monitoring and Evaluation in the State Department for Planning, for a precise, clear, and informative presentation, also keeping within the time allocated. On the presentation was on the theme on research, data, and innovation. We have 2 more presentations to go. And the next presentation will be on the theme on education and training. The presentation will be made by Reverend Canon Chris Kinyanjui, the chairperson of the National Council of Churches of Kenya. And he will make this presentation on behalf of this breakaway session. Karibu sana, Reverend Canon Chris Kinyanjui.
Thank you, Chair. Let me take this opportunity to thank you and present on behalf of Reverend Chris Kinyanjui, who is held up in another meeting. And this session was Team 7, and it was on education and training. So we had 4 presenters under this session, and that was Frederick Muchumba from the Directorate of Secondary Education and Special Programs. Another one was Ifli Nanupi, that's the Director Planning TFET. The third person was Mr. Joseph Wasikongo, the National Coordinator for Elimu Yetu Coalition. And the last presenter was Ms. Margaret Wanjiku, who is the Policy Manager at Innovation for Poverty Action. So the session objectives for this Team 7 was to highlight the role of education and training in preparing young people to contribute to socioeconomic transformation of Kenya. It was also to share the challenges and opportunities in provision of universal quality basic education in Kenya. And lastly was to provide evidence on the impact of education and training on poverty alleviation. The moderator for this session was Reverend Canon Chris Kinyanjui, and he noted that the demographic dividend window for Kenya is expected to open in the year 2038. So, and for this, the nation's future labor force must be educated, skilled for enhanced economic productivity. And for the country to achieve this, the current education and training system must prepare the country's young people to achieve a meaningful share in driving the nation's socioeconomic transformation agenda as envisioned in Kenya Vision 2030 Development Blueprint. So the first presentation was done by Frederick Muchumba, and it was focusing on preparing Kenya's future human resources for social transformation. So the key highlights from this presentation was that Kenya's development largely depends on natural resources and human capital. So, and human capital may be increased by investing in education and healthcare. So it was recommended that there is need to enhance basic education with focus on developing relevant knowledge and skills. The second presentation was done by Ifli Nanupi, that's the Director Planning, State Department for TFET, and it was on enhancing employability and life skills of Kenya's youth for improved productivity. So the key highlight from this presentation was focusing basically on the characteristics of the Kenya's population. And it was noted that Kenya is a youthful population comprising of 40% of the working age population. So under such, there is a need to devise ways of improving the quality of jobs to meet the aspirations of the youth through sustainable programs. It was also noted that approximately 800,000 youth enter the labor market annually, and youth unemployment is estimated at 5%, which is higher than the national average of 10%. So it was also recommended that there is need for policies that align education programs with training and focus skills required in the market, and particularly for the youth. So investments in vocational training for self-reliance among the youth. Again, it was noted that the number of youth not in employment, education, or training are expected to rise. And this is something which calls for attention. So again, there was also a recommendation for the need for the private sector, academia, and government to work together to develop innovative business models, industry-relevant curricula, and enabling national policies so as to curb youth unemployment. So the topic 3 was presented by Joseph Wasikongo, the National Coordinator, Elimu Yetu Coalition, and the topic was on quality basic education for all Kenya's, for all Kenya's challenges and opportunities. Some of the key highlights from this presentation was that the presenter mainly emphasized on the need to increase the tax base by creating employment for the youth, and that there are barriers in achieving a quality basic education. And some of these barriers are inadequate infrastructure, there is a teacher shortage, and also gender disparities. And these are some of the barriers that hinder the achievement of quality basic education. So there was also a recommendation that there is need for government to mobilize and allocate more funds to the education sector, particularly on development. So the last presenter was Margaret Wanjiku Wanjoy, policy maker, innovation for poverty action. So the presentation was on impact of education and training on poverty reduction efforts. Some of the key highlights from this presentation were majorly on young people, and it was noted that majority of young people are employed in the informal sector. So on quality of education will boost the country in reaping the demographic dividend. It was also recommended that it's need to adopt a life course approach to learning that encourages a wide range of subjects and topics. Again, it was noted that women lag behind men in their participation in labor force, and that there is still a gap in wage and non-wage income. So the presenter shared some findings from some evaluation which was undertaken, and from these findings, it indicated that entrepreneurs face a rapidly changing market where they lack education, skills, and work experience necessary to run successful business. So, and it was recommended that there is a need to establish information hubs and ICT models in rural and peri-urban setups for access to job opportunities among the young people. So again, it was recommended that the national and county government should enhance coordination of youth empowerment and employment policies to improve implementation and realize better results. Thank you. That was the highlights from the education and training sector. So I'm Bernard Kiprotich, presenting on behalf of Reverend Canon Kinyanjui. Thank you.
Thank you very much, Bernard Kiprotich, presenting on behalf of Reverend Canon Chris Kinyanjui, Secretary General, National Council of Churches of Kenya, on the thematic area of education and training. I want to thank you for a precise and clear presentation on behalf of that team, and also keeping within the time allocated. Now, last but not least, we will have the presentation on resource mobilization. And this presentation will be done by Honorable David Mboni, MP, Kitui Rural, and Member Finance and National Planning Committee of the National Assembly. Karibu sana mheshimiwa.
Thank you very much, Chair, for giving this opportunity to do the presentation of resource mobilization. And I'm doing it on behalf of Honorable Gladys Wanga, who is the Chair of Finance and Planning Committee. And I'm David Mboni, Member of Parliament, Kitui Rural. Chair, with all said and done, all this activity requires resources, and resources are scarce in any other country. And here, this presentation is in 4 parts. There is the background, there is the highlights on human resource mobilization. There's also opportunities and the recommendation, which is the last one. Here, Kenya, after the revision of National Account 2008, the country was declared a low middle-income country. And the Vision 2030 anticipates the country will become middle-income country. But this one also comes with the responsibility of ensuring that the population development programs at national and country levels are well resourced to ensure high-quality life to all Kenyans. The conference gives the public and private sectors the opportunity to share experiences and recommendations in inventing ways of resource mobilization, population programs. Chair, on the resource mobilization highlights. For the country to become industrialized, middle-income country, we need to invest in human capital. This one we are talking about education, health, because a country which has no health population and educated, skilled population can really not develop. So this is very, very critical, and it will highlight in the meeting. But there's also a critical question, which is availability of resources with a rapid population growth and high education ratio. Chair, from my findings, is that the country has been facing challenges in resources, especially from the government side. Under the revenues have been going down from 25% of GDP in 2013 to 17% currently of GDP. And this one gives us a very big challenge in terms of where do we get the resources to fund some of these programs. The meeting also recognized the role of private sector in supporting and funding population and development. It also found the population, public and private sector to work together so that to address population challenges. One of its core functions should address not just resource mobilization, but also deployment based on futuristic trends easily discernible from the unfolding world of the fourth industrial revolution. The fifth finding was accountability and transparency in resource management and tracking resources for evidence generation with strengthened resource mobilization. And this is very important. The sixth one was over dependence on external funds. You know, I remember when I was working with the government, National Bureau of Statistics, UNICEF used to fund a lot of health activities in this country, and this one of the things which we need also to check out, that we need to depend more on funding from the country, from home resources, so that at least we can be sustainable. The third one was key programs, including SRSR, are over reliance on donor resources, which is unsustainable. In fact, that's the same with the sixth one, because we need not to rely so much on donor funding. The seventh one finding was shift in donor funding priorities, because donors keep on changing their priorities from this sector to the other one, and therefore it's very important to rely on our own funding. The ninth one is constrain bilateral aid budgets and increase dependence on the international financial institution. Most of the countries are finding financial challenges, and you realize that where we can really get money is IMF and the World Bank, which also with the time we also been finding it's very difficult to fund some of these activities. Chair, there's also opportunities in this, which was highlighted in the meeting. One of them is forging long-term relationships with the donors and the benefactors with aim of creating sustainability away from one-touch transaction approaches. Basically, the relationship should be long-term, whereby the donors and us the donors should fund long-term programs so that at least there's some sustainability. The second one was interlinking partnership with resource mobilization in order to maximize the surrender value of shared resources, including human capital. The third one was thinking about non-monetary resources as an integral part of resource mobilization, particularly where technical capacity and support may be qualified as a resource. This is, to me, this is very important. The fourth one was building a long view with significant partners that in turn promises predictable funding based on shared values and objectives. This is almost the same as number one, whereby you need a long-term relationship for funding. The fifth one was organizing funds through annual events set around conferences or letters of request, premises on the achievement of certain measurable goals. And this comes away of really having proposals and, of course, coming with measurable achievements so that at least anybody who's funding this really sees the results. The sixth one is switching to budgetary in accordance with needs assessment as opposed to expected resources, identify the most critical goals. And basically this one is the funding should be demand driven, not supply driven. I mean, it must come up with the really critical goals and areas we should be funded so that at least you can achieve whatever needs to be achieved. In terms of recommendation, the meeting recommended government to step up easy revenue allocation in population programs. Chair, as a member of a finance and planning committee, this is a challenge. Last week we were going through the budget allocation, and it happens that NCPD is one of the institutions which is being funded under Minister of Planning and National Development. And then seriously, when you look at the budget for the department, it has been going down, and the government should really come up and fund these programs. Move from budget allocation to budget actualization, including the fencing, as specific budget lines for population programs. Basically, this is very important. I mean, at times the budgets are given, and due to one reason or the other, the money may not be utilized, and that one means that it's gone. So reinventing the funding is very important, so that this money does not go back to the exchequer. The money can still be used even after the financial year elapses. That one was to structure funding dialogues to reflect new realities driven by the knowledge, era, and unprecedented technological breakthrough. This one, the program designers should be able to really structure the funding. The fourth one is align resources to global thematic development ideas such as sustainable development goals. The fifth one is strengthen financial accountability for ICPD 25 commitment by non-state actors. The sixth one is communicate results in a visible manner that encourages partners and donors to come up or stay board. Basically, this one is how do you disseminate the information after you get the information, after the programs are funded. How do you actually submit that program, the information to the donor, so that they can actually appreciate and they can appeal more funds to it. The sixth one is advocate for. Sorry. Sorry for that, Chair. The seventh one is advocate for domestic financing of population and development partners. I think that's what we have talked about. That the government should actually create funds to fund the population development programs. The 81 is strengthening the cooperation between the public and private sectors. Chair, currently we are doing what we call public-private partnership review of the Act, and I think that's one area whereby we can look at as a country and see how the private sector can partner with the private sector to fund some of these programs. The ninth one is exploring innovative ways of funding engineering development impact. There's 81 tightening the cooperation between the public and the private sectors. I think that's what I was saying. 91 exploring innovative way of funding engineering impact both for underserved SRSHR. The third one inclusion of funding for private program NGSRH services as part of post-COVID recovery initiative. The 11th one is invest in community philanthropy, and 12th one invest in population data research and innovation. This is one area which is really which is underfunded, and we are seeing that a surveys which used to be there like KDHS, Kenya Demographic and health survey around EPI, and this should be done every 5 years. I think now it's like EPI, and the government should be able to avail money to fund some of these researches. The sixth one is linked population program with plans for economic productivity and projection. And the last one is prioritize financing adolescents' youth sexual reproductive health and allocate the budget line. I think this is very important for resources. So basically, what this one is saying that this sector requires funds. It's lacking funds. It requires funds from both government and from the government and private sector. And the government should come up with programs which can be easily funded. The part in short is the present is where we get lost if we forget our past and have no vision for the future. By Awi Kwe Hammer. Thank you very much, Chair.
Thank you very much, Honorable David Mboni, MP Kitui Central, Member Finance and National Planning Committee of the National Assembly, representing Honorable Gladys Wanga, who is the chair of that committee. I want to thank you for a very precise, clear presentation on the highlights and recommendations of a very important area, a very important theme on resource mobilization. And we believe that this will inform the way forward and the resolutions that will arise from this particular conference. Distinguished delegates, ladies and gentlemen, we have listened to 8 presentations on the 8 themes discussed during the breakaway sessions of this conference, each theme consisting of several sub-themes. I wish on behalf of all of you to thank our 8 presenters. The 8 presenters we had were Ezekiel Ngure from Ezekiel Ngure, then we had Beatrice Okundi, we had Dr. Sheila Masharia, we also had Dr. Linda Oucho, Professor Edward Mburugu, Mr. Alois Ratemo, Bernard Kiprotich, and last but not least, Honorable David Mboni. Now, the presenters have well articulated and very precisely and clearly the presentations and the discussions of the 8 breakaway sessions. They've given us rich content, and this content forms what we will have as recommendations and resolutions from this conference. The recommendations and action points on the key thematic areas will inform the final national population policy. They will also provide a basis for the important resolutions and way forward that will re-energize multi-sectoral strategic partnerships and collaborations at both the county and national level on specific, prioritized, and targeted population and development programs, including quick wins. And all these are aimed towards achieving the Vision 2030 and the Sustainable Development Goals. An important thread that has run through the discussions and the presentations that we've had this morning on all the 8 themes and in the last 2 days is the importance of a multi-sectoral approach, strengthening partnerships and collaborations, matters of coordination. These are key takeaways from this conference. Undoubtedly, the discussions of the last 2 days will continue in other fora at the national, regional, and international level, and to inform policies and programs and even new areas of research. As I conclude this session, let me thank the chairs and moderators, panelists, and rapporteurs, and all those who participated in the breakaway sessions. Distinguished delegates, ladies and gentlemen, we have come to the end of the plenary session. On the highlights, the recommendations and action points drawn from the discussions of those sessions of the 4th National Leaders Population and Conference and Development Conference. We will now take a short break before we come back for the final section of this conference. which will constitute the reading of the communique arising from this conference and the closing ceremony. I thank you for your participation and God bless you all. Thank you.
Amani Kenya, ili tuishi kama zamani. ya amani, nchi ya kupendeza. Kenya ni nchi ya upendo, twajivunia nchi yetu. Umoja ni nguzo yetu, tupendane wana Kenya. Serikali yetu ni imara, kweli tumeona. Umoja ni nguzo yetu, tupendane wana Kenya. Serikali yetu ni imara, kweli tumeona. Kenya ni nchi ya amani, nchi ya kupendeza. Kenya ni nchi ya upendo, twajivunia nchi yetu. Kenya ni nchi ya amani, nchi ya kupendeza. Kenya ni nchi ya upendo, twajivunia nchi yetu. Tumeona maendeleo pembe zote za Kenya. Pongezi serikali yetu kwa huduma bora. Tumeona maendeleo pembe zote za Kenya. Pongezi serikali yetu kwa huduma bora. Kenya ni nchi ya amani, nchi ya kupendeza. Kenya ni nchi ya upendo, twajivunia nchi yetu. Kenya ni nchi ya amani, nchi ya kupendeza. Kenya ni nchi ya upendo, twajivunia nchi yetu. Ajenda ya serikali kuboresha kilimo, ujenzi wa nyumba matibabu kwa Wakenya wote. Ajenda ya serikali kuboresha kilimo, ujenzi wa nyumba matibabu kwa Wakenya wote. Kenya ni nchi ya amani, nchi ya kupendeza. Kenya ni nchi ya upendo, twajivunia nchi yetu. Kenya ni nchi ya amani, nchi ya kupendeza. Kenya ni nchi ya upendo, twajivunia nchi yetu.
Yebo. Tunaipongeza serikali yetu Kenya.
Tuna maendeleo mengi kote Kenya.
Tunaipongeza serikali yetu Kenya.
Tuna maendeleo mengi kote Kenya.
Tunayo imani na serikali yetu Kenya.
Tumeshuhudia uongozi ulio bora.
Tunayo imani kweli na serikali yetu Kenya.
Tumeshuhudia uongozi ulio bora.
Hongera serikali yetu na maendeleo. Hongera serikali yetu na maendeleo. Tunafurahia matunda ya uhuru wetu.
Kweli tumepiga hatua kwa maendeleo.
Tunafurahia baba matunda ya uhuru wetu. familia zetu,
ili serikali iweze kujipanga vyema.
Tunawahimiza sote tupange familia zetu,
ili serikali iweze kujipanga vyema.
Tuzae watoto wale tunaweza lea,
wapate elimu, matibabu, malezi bora.
Tuzae watoto wale tunaweza lea,
wapate elimu, matibabu, malezi bora.
Hongera serikali kwa umoja wetu, kwa umoja wetu. Hongera serikali yetu, kwa umoja wetu,
umoja wetu.
Hongera serikali yetu, kwa umoja wetu, umoja wetu. Hongera, hongera serikali yetu, kwa umoja wetu.
Sambaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Sambaza sauti zetu wa Kenya, kuwakumbusha Kenya ni moja. Sote tuungane tujenge Kenya, Kenya ni mama yetu sote. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali kwa uongozi maridadi. Twaipongeza serikali yetu, maendeleo tumeona, na ugatuzi ni baraka kwetu, matunda yake tumeona.
Dear distinguished delegates, welcome back to the break. I'm Dr. Mohammed Abdelkadir Sheikh, the Director General for the National Council for Population and Development. We are just coming to the end of our conference, but I just want to say what an incredible conference for the last 2.5 days. I think it was, for me, it was really amazing. You know, the energy, the passion, the discussions, the quality of the participants, really, it has been a very amazing 2.5 days. Now we're just coming to the end. We're going to go to the official closing of this ceremony. But before that, we're going to read the communique of this conference. You have seen the discussions and the key highlights from the different thematic areas. We have put that one into our communique. That communique we're going to share with the delegates so that also we have your inputs. And after that, again, we're going to go into the official closing of this ceremony. With us here this morning, we have our chief guest, who is the Chief Administrative Secretary of the State Department of Planning, Mheshimiwa Eric Simiyu. We also have with us our PS, who's going to join us very soon, Saitoti Torome. With us also, we have the Chair of Maendeleo Wanawake, Madam Rehab Miu, and also we have the Chair of PRP, that is the Population Reference Bureau, Angelina Siparo. So those are the guests we have this morning. We're going to make remarks during the closure of this ceremony. And also, that's also on virtual, who's joining us virtually, is UNFPA Country Representative, Dr. Adimola. Dr. Adimola, are you there? So we'll be inviting him later to make his remarks. But now I want to invite Lucy Kimondo. Lucy Kimondo was the one who was leading the secretariat together with Peter Nyakwara. from NCPD, and this team has done wonderful work. And for me, as the Director of National Council for Population Development, I want to appreciate really the work they've done. So she's going to read for us the communique, and after that, we will have reactions, probably through your chat. We'll be broadcasting the chat there, but you can put any comments and concerns that you have on the chat. And then with those comments, we are going to enrich our communique and share again with you on the final communique that we have. But for the time being, I want to invite Lucy Kimondo to give us the communique for this conference. Lucy, welcome, please.
Good morning, everyone. I will present the communique. This is a draft communique because you put comments on the chat book, on the chat, so that we can actually enrich it and finalize it. Then once it is finalized, we are going to put it on the website. You are all aware of the website, so that you can download it from there. So with the delegates attending the 4th National Leaders Conference on Population and Development held virtually from 26th to 28th May 2021, themed Investing in Human Capital for Achievement of Kenya's Vision 2030. Welcome the collaboration of the government and population stakeholders in organizing the 4th National Leaders Conference on Population and Development to deliberate population and development issues. Appreciate the government of Kenya's commitment towards prioritization of the population and development program, which is a key driver for achieving development aspirations. Acknowledge the role the government, development partners, CSOs, CBOs, FBOs, private sector, and other key players in the implementations of the country's population program. Recognize the success made in the implementation and achievement of the population program despite continuing and emerging population and development challenges, which require critical policy and program interventions. Emphasize the need for strengthening multi-sectoral coordination and implementation of population and development program that cuts across all sectors. Recognize data quality is required to establish evidence base for determining the status of progress on National Vision 2030, SDGs, and ICPD 25 commitments. Reaffirm our commitment to supporting and implementing the population program to accelerate the achievement of Kenya Vision 2030 and make the following resolutions. Under the theme population size and age structure, encourage county-specific programs that harness the demographic dividend to achieve Kenya's Vision 2030. Advocate for enhanced investments in social protection programs. Develop programs that create awareness and respond to the needs of the vulnerable groups in the society, that is including overseas, elderly, people living with disability, displaced persons, and refugees. Enhance community engagement to identify the underlying socio-cultural issues that negatively affect the population. Encourage population programming interventions that are life course oriented. Develop county-specific programs specifically for youth to ensure provision of integrated youth-friendly services. Mainstream gender in all sectors. Under fertility, strengthen family planning initiative and prioritize domestic financing of family planning commodities and services, develop innovative programs that will eliminate teenage pregnancy and child marriages at community level, strengthen community-based services for reproductive health to address teenage pregnancy, engage community leaders to address child marriages, strengthen male involvement in provision of reproductive health services, including family planning, identify the barriers that negate desired uptake of family planning in different regions of Kenya and address the barriers appropriately, strengthen public-private partnership for sexual reproductive health, including family planning, under morbidity and mortality, support the health system strengthening through the 6 pillars of the health systems. I won't read all of them. Address persistent disparities in health indicators across different segments of the population and across counties. Commission studies to examine the widening sexual differentials with regard to leading causes of mortality. Increase domestic health resource allocation for sustainable programming. Advocate for the, I think I've jumped something. At migration and mobility, migration and urbanization, advocate for finalization of national migration policy, develop county-specific programs that mitigate the loss of human capital in migration-setting areas, mitigate pressure on resources, employment, and insecurity on the recipient areas, implement fully the international migration governance, including various protocols on free movement of people, advocate for resources for non-motorized transport, address concerns on competitiveness of the country to attract investments, conduct regular migration surveys, enhance administrative data collection and sharing among agencies, enhance provision of social housing in urban areas, advocate for the implementation of special planning zones to address mobility in informal settlements, encourage solid waste sorting at source. Under population, human settlements and environment, develop appropriate land use plans and employ innovative approaches for their implementation, advocate for multi-sectoral programming to address climate change, develop disaster preparedness responsive strategies, mainstream hazards, disaster and risk response in the existing education curricula, advocate for participation of women, youth, vulnerable groups in hazard and risk response interventions. Other education and training, advocate for implementation of competence-based curriculum, revise education curricula at all levels to include life skills, entrepreneur studies, and reproductive health issues, encourage skills match with I think there's a problem there. Encourage skills match with existing job market, I think is advocate for skills match. Strengthen partnership in provision of education training. Scale up information and education campaigns in communities that still practice harmful traditional practices such as female genital cutting and early marriages. Increase resources for education at all levels. Strengthen data collection and analysis on employment, establish information hubs and ICT models in rural, peri-urban setups for access to job opportunities. Under data innovation and research, strengthen data collection mechanism to capture disaggregated data on all segments of the population, develop a comprehensive and up-to-date information database that document all disasters, conflict and displacement, improve coverage and harness data from administrative system. Examples are given there. Enhance data accessibility and utilization. Operationalize the 2019 Data Protection Act to guide collection, processing, and use and storage of population data and information. Add a resource mobilization. Strengthen private-public partnership for leveraging resources and leveraging resources and increase financing. Advocate for budget actualization, including ring-fencing and having specific budget line for population program. Prioritize financing of adolescent and youth health. Strengthen financial accountability for ICPD 25 commitment by non-state actors. Align resourcing to global thematic development ideals such as the Sustainable Development Goals. Link population programs with plans for economic productivity and projections. Mobilize resources to fund population and development research. There was one cross-cutting issues we need to continue to monitor, evaluate, mitigate, adapt to the effects of COVID-19 on implementation of the country's population program. Therefore, we call to action all the population and development stakeholders to advocate on issues of population and development across all sectors. The government of the Republic of Kenya to address existing policy gap to respond to population and development challenges. The population and development stakeholders to enhance their support towards population and development program. The government and stakeholders to enhance collaborations towards generation of data for evidence-based decision-making. The government, development partners, and population stakeholders to increase financing for the population program. Thank you for your attention.
Kimondo, that was, dear delegates, that was a communique from this conference. That's a draft communique. We request for your inputs. This will be shared through our website, the NCPD website, and also the conference website, and also through the chat. Right now, you can chat and have comments on that communique. We will have the final, and we'll share with you through our partners and other systems. Now it is my pleasure and honor now to start our official close of this conference. We started this conference on Wednesday, 26th. We started with an opening remarks from His Excellency the President, who was represented by our CS, the Cabinet Secretary for the National Treasury and Planning, and our PS also. Today we're here, we have the pleasure and the honor of this conference to be our chief guest is the Chief Administrative Secretary for the State Department of Planning, Mr. Eric Simiyu Wafuko. And also we have the pleasure of our PS, the State Department of Planning, Saitoti Torome. We also have our board members. With us is also our board chair, Honorable David Ngugi. We're also going to give the vote of thanks on behalf of the institution. We also have with us is the Maendeleo Wanawake, who is also a board member of the NCPD, and also Angelina Siparo, who is a country director for PRP, and also we have Dr. Adimola, who's joining us virtually. So with that, I just want to start with first with the remarks. I'm going to invite the country director PRP, Angelina Siparo, to make her remarks, And then later on, I'm going to start to invite the chairman, Ndele Wanake organization. Angelina, welcome, please. Make your remarks.
Good morning. It's still good morning. Good morning, fellow participants. And I want to start by acknowledging our CS, Eric Simiu, our PS, Etoti Torome, the NCPD board chair, Mr. David Ngugi, Chair Maendeleo Wanawake, Madam Rahab Nyuhu, the DG for NCPD, Dr. Mohammed Sheikh, UNFPA representative, fellow participants, ladies and gentlemen, hamjambo. So first of all, I am honored to stand here, and I give glory to God for this moment that we are all standing here, because given the COVID epidemic, it is not automatic that we are all going to be here. And I want to start by congratulating our CAS, Honorable Yakuri Etali, and his entire team represented today by our CAS and also by our PS. Special congratulations to the entire NCPD team through the chair and Dr. Sheikh. I speak today as a country director and East and Southern Africa advisor for Population Reference Bureau, and we have partnered with NCPD since 1998. So we qualify as a key partner at this table, and we are honored to have that partnership. Through these years, we have found NCPD a worthy and an outstanding partner to work with. I also wear two other hats today, as Chair, National AIDS Control Council, and also on behalf of all the partners that work with NCPD. PRB is honored to have a long-standing relationship with NCPD that has led to stronger and more effective policy advocacy in the pursuit of achieving high quality of life for all Kenyans that is sustainable with available resources as envisioned in Vision 2030. As chair of NAC, I want to pause here for a minute and welcome my fellow chair. Karibu sana, Honorable Ngugi. We look forward to hosting you at our HIV/AIDS conference that's going to be taking place from 14th June for 3 days. This is our normal HIV and research conference as we continue to build bridges in reproductive health. Dr. Sheikh and others that I work with will attest that I have walked the dual role of being both in the family planning reproductive health world and also being in the HIV world for the last 18 to 20 years. We look forward to synergies on implementing as one government. No one can do everything, but together we can do a lot. Karibu sana, my brother. And we will stand by you, we shall support you, we shall be there for you. The culmination of the population policy review process in this conference has been a strenuous but fulfilling exercise, given all the spanners that COVID has thrown to us in the process. It's not been easy. I know the NCPD team, working closely with the Council of Governors under the leadership of Dr. Sheikh, have really worked hard. But before we go further, I would like to take a few minutes to recognize the following. Kenya's Vision 2030 recognizes that rapid population growth calls for investment that respond to the needs of the people, especially the most vulnerable and hard to reach. To effectively achieve this, there is need for strong policy interventions that are backed by readily available and reliable data to inform implementation and investment priorities. And I pause here because for me, I have two special interests in the statement I've just read. The first one is I have interest because PRB specializes in data and producing evidence for good decision making. But also, if you look at the KDHS 2014, I come from a region of this country that is got the lowest maternal and neonatal indicators, and also very poor statistics in terms of people who have gone to school, mothers who still do not have access to healthcare. And so for those of us from the pastoralist and nomadic communities, we have a special stake in the development of this population policy. But beyond that, as one Kenya, we bring our voices so that there's recognition that not all areas are equal even as we proceed. The consultative process of the Kenya State Department for Planning, National Treasury and Planning through the National Council of Population and Development demonstrate the government's commitment to an all-inclusive policy. This has been the most rigorous process I have ever seen. We were involved in the 2012 policy, but at that time it was from a different hat that I was wearing. But one of the things we have seen is the rigor in which we have made sure there is inclusion, and especially the voice of the counties looking at the divorce structures. The former policy was good at a national level, but it did not take into cognizance the fact that we had moved into a new way of devolved government. I also want to mention that this engagement is timely, especially with the emergence of a global epidemic that has brought to the fore systemic challenges that need to be urgently fixed. We are experiencing new concerns, particularly for adolescents and youth highlighted by the COVID pandemic. And this is a place where I want to mention to you that the one issue that we want to look at is the issue of teenage pregnancy correlates very well with the increase in terms of HIV prevalence among adolescents and young people. So we have no choice but to sit at the table together because it's our children and it is one child. And so even though we sometimes have parallel ways of operating, although sometimes we are reporting to different county cabinet secretaries, overall, we are responding to one government and one vision. The pandemic has affected young people across multiple outcomes, including education, livelihoods, sexual and reproductive health, sexual and gender-based violence. And all these have articulated in the communique that has just been read. The burden of unpaid care, early and forced marriages, just to name but a few. These heightened barriers to economic and social opportunities and the resulting loss of human capital have the potential to derail progress and less recognized and addressed. In the short and medium term, these matters need to be addressed using evidence to ensure a healthy and vital young population that is positioned to take leadership and contribute to economic growth. We all know the ongoing challenges that COVID has brought. And I also want to, at this point, just recognize our keynote speaker, Dr. Elia Zulu. He really articulated the challenges we have looking at our population issues and some of the quick and necessary steps that must be taken as part of the implementation of this policy. While the process of revising and improving on the current policy is laudable, it is important to effectively implement the strategies that have been documented. We need to move from reports and documents to action. Over the past decade, we have harnessed some important lessons, identified some great opportunities that have been confronted with ubiquitous challenges. All these lessons form a good basis for the population policy that will require multi-sectoral commitment and a collaboration to put it into effect. We also call on Parliament to consider how to reward counties that manage their populations and resources. The current formula, though practical, rewards the higher population counties. This is counterintuitive. And I want to mention that this issue was discussed during the first plenary chaired by my esteemed colleague, Dr. Kamarogo. And Dr. Sheikh and the leadership of our ministry, we just want to mention that there's going to have to be ongoing conversations with the Council of Governors and the Senate and the Parliament to make sure that our sharing revenue does not act against our own population policy and the move towards high quality of life for all Kenyans. In conclusion, PRB remains committed to working in close collaboration with the Ministry of Health through NCPD and county governments to synthesize data and enhance policy communication in order to constructively influence population policy decisions. I also speak on behalf of the other partners that work closely with NCPD on our commitment to bring the communique that has just been read to life in practical ways. We want to move from paper to breaking that down into a roadmap for how can we support Dr. Sheikh's team in the implementation of the issues that have come up during this conference. And so, because I come from the Population Reference Bureau and we are the advocacy and data people, I want to issue a call to action. We need to mobilize resources and invest in population development and research. That has also been articulated in the communique. We need to clearly bring out strategies for dissemination of the final national policy for population and development. It is not enough that we have a good policy. Dr. Sheikh's team will have to get ongoing support to be able to do the dissemination. Establish a comprehensive implementation framework and a plan of action, as well as an M&E strategy. And then finally, build partnerships for the implementation of the national population policy dissemination. And I also want to mention that one of the guidance that I have seen working within COVID is to think globally, but to act locally. What this means is that there are people who have done the work that we are doing before. So how do we document and share lessons learned nationally, regionally, and globally? But most of all, as I speak on behalf of the partners, they say that a rope with 3 strands is not easily broken. And so even as we come, government, civil society, and the other sectors that are involved in this process, we are committed to supporting NCPD. We are committed to taking this further and to roll out the population policy. And we are honored, and it is such an honor to be able to be here and to be part of this conference and to look forward to its implementation. Shukran, Dr. Sheikh, and over to you.
those wonderful remarks. But dear delegates, I just want to state NCPD is mandated and charged with issues of coordinating population program in Kenya. It was established in 1982, and this institution, since our establishment, PRP had remained a reliable partner. And that's why we invited Angelina Siparo to speak on behalf of the other population stakeholders, because PRP really has supported issues of population programming in this country for a while. And even this conference, they're the one who are supporting us together with UNFPA, AFIDEP, and other organizations. And I think issues of population really is a multi-sectoral. It requires multi-sectoral coordination. NCPD can just provide the platform like the way we did this conference. So, but we want all the partners who are involved really to be active and participating in this endeavor. Ladies, with that, I want also now to take this opportunity to invite again another wonderful madam who is the chair of Maendeleo Wanawake, Madam Rahab Miu. She's also a board member. NCPD is really blessed with a variety of board members. We have Maendeleo Wanawake, we have FIDA, we have the religious leader, we have SUPKEM, we have KCB, we have the Catholics, Secretary General there also, and then also we have directors who are also part of our board. So we're very blessed as a board, and I want to take this opportunity to invite our chair, Maendeleo Wanawake, Mrs. Rahab Miu. Welcome, madam.
Good morning. I think it's nice to speak after my former chair in NAC and just hear the work which has gone into population. Talking as a mother, we've seen the journey of family planning in our time over 40 years ago, and we are seeing the journey today. So the Chief Administrative Secretary, our chief guest, Mr. Eric Simiyu, the Principal Secretary, Department of Planning, Mr. Saitoti Torome, my chair, NCP Board, Honorable David Gugi, my former chair, NAC, Angelina Sparrow, our brother, Dr. Andemelo, Dr. Olejide, who has been very great supporter of Maendeleo, our DG, Dr. Sheikh, my sister, Economic Secretary, Mrs. Catherine Mwoki, partners in population development, dear delegates, ladies and gentlemen. On behalf of Maendeleo ya Wanawake, which was there from 1952, 70 years next year, we've been founders in a lot of these institutions, whether it is NAC, whether it is NCPD. On their behalf, we want to congratulate our PS, our CS, Ambassador Yatani and his team, our DG, for a job well done. We thank you. I want to take this opportunity to say that during the conference, we have been able to listen to presentations and discussions on how we are going to harness our population dynamics and invest in human capital to achieve Vision 2030 and SDGs. Furthermore, we have built consensus and developed key action points and recommendations for the national draft policy. The goal of population policy is to attain a society in which all the people are secure, healthy, broadly educated, empowered for improved quality of life for today and for the future. Kenya has made significant progress, and indeed Maendeleo has been part of this journey. My predecessors, who I sincerely thank, have walked this journey with the government of Kenya. In regard to promoting gender equality, women empowerment, though there still exists gender inequalities in the socio-economic and political spheres, the participation of women and their contribution to the economy is underrated, with the women and girls working often and paid jobs, it sometimes is invisible. The majority of our women work in the informal sector, with only 34% working in the formal sector. Further, women are more concentrated in sectors that have lower average wages, especially agriculture, where most of our women are, education, as well as they own a nominal percentage of assets. And we know land is an issue for many women in this country. These factors affect the extent to which women can take advantage of new methods of production, information, knowledge, and available skills for gainful livelihoods. On the other hand, the country has seen an increase of women in decision-making positions like cabinet secretaries, principal secretaries, and many elected positions the women hold. For realization of the population policy, Kenya's Vision 2030, and other national, regional, and international policies and obligations, there is need to develop and implement gender-responsive policies, programs, budgeting, as well as implementation of socio-economic and political empowerment programs for women. It is good to talk about the teenage pregnancies, and in conclusion, I'll talk about it. In conclusion, I want to say that as we listen to the conference, poverty is key. And a lot of these things we talk and say are not going to end if we do not look at the issue of poverty, the teenage pregnancies. And one of the speakers in the beginning, and I want to address my chair, Bwana Mheshimiwa Ngugi, and the DG, we heard that 2.3 million children have no jobs. It was clearly spelled in the first day. And we were told those children, to me, because I've been in the field, I think they are slightly more than 2.3 million. So therefore, our children have been reduced to voters, waiting for politicians to clap hands for them. And it is very painful. And the only way out, we listened to when Speaker Lusaka spoke and the money going into the counties. We are not going to help this country. If these children, even if you just get in Koinange Street, you will see how many children are walking in the streets. Even if you just walk around Kipande Street, you see how many children are idlers. So 2.3 number, my chair, is a number we cannot move forward. Chief guest today, PS, this is an issue we really need to look at. What do we do with these children? I had recommendation of industries in all the 47 counties, but we cannot only leave this to politicians. There needs to be some clear decision from this conference, what we do with these children, because these are the voters we see waiting for the meetings in the country. And therefore, for me, even the teenage pregnancies is as a result of this boys all over the place and girls. And therefore, in conclusion, I want to assure the delegates of this conference, our cabinet secretary, who we sincerely thank, Ambassador Yutani and his team, NCPD, our DG, and other key stakeholders who has really worked very hard as we welcome our chair, that Maendeleo Wanawake, which is the biggest and oldest women organization with almost 4 million members, and we are all over the country, whether it is in the ward, in the sub-county, in the nation, that we will support the recommendations like we have always done, and the outcome of this conference. Maendeleo will be waiting for the implementation, and we will be ready and waiting to work with you. We thank you very much. May the good Lord bless all of us.
Chair Maendeleo Wanawake, Madam Rehab, for those wonderful remarks. And NCPD looks forward working with you, with your rich networks across the country. And we've worked with you before and with your team, and we'll strengthen that collaboration. Thank you very much for those remarks. Ladies and gentlemen, at this juncture, also I want to, at this juncture, invite the UNFPA County Representative, Dr. Ademola Aloyede, a very reliable partner, very reliable also friend. Chair, before we, with this conference, we wanted to do it first physically, but then we had challenge of the COVID, and then, because that is how Kenyans initially were used to meeting. But then I had to reach out to friends and ask them what is the best way. And I reached out to Ademola. Today, the Zoom we're using here belongs to UNFPA. I want to acknowledge that. NCPD is going forward, will buy its own Zoom, but I have to acknowledge that because that's what we're using. The technology team that is here Apart from, we have our team here, but we have been supported also by UNFPA team. So I want to appreciate that support. Dr. Ademola, thank you very much for the support, and the floor is yours to make your remarks. Welcome.
Thank you very much, Dr. Sheikh. The chief guest, Honorable Eric Simiyu Wafuko, the Chief Administrative Secretary, State Department of Planning, Mr. Saitoti Torome, the Principal Secretary, State Department of Planning, Honorable David Nguge, the Chair, NCPD, Madam Ria Mio, the Chairperson Mandeleo, Ms. Angeline Cipero, the Senior Country Director for the PRB, distinguished guests, ladies and gentlemen. Indeed, the deliberations of the last few days have further reinforced for us what we have always known, that unless we address population issues in a coherent manner, Kenya will not be able to optimally harness its economic potential and the plans and the policies and the goals and targets which has been set as a nation. We will have significant challenges in delivery. Therefore, it is important that the recommendations which have come forth over the last few days are articulated in a coherent manner that seeks to create an enabling environment where every single Kenyan is able to optimally thrive within the national system and policy. The recommendations and discussions of the last few days have further reinforced the fact that the ICPD 25 commitments, which were made by His Excellency the President at the ICPD 25 summit, is not only relevant to the attainment of the Sustainable Development Goals, but it's indeed very key in facilitating the delivery of the Vision 2030. One thing becomes obvious, that the nation of Kenya does not lack knowledge, neither does it lack expertise. What we have to then do is for us to collectively harness the knowledge and the expertise, which has been very well demonstrated over the last few days, to ensure that going forward, we finalize the new national population policy and ensure that we strengthen the coordination. As Dr. Sheikh has mentioned, the NCPD has the statutory function of coordination. And therefore, in moving forward, we must ensure that that coordination function is strengthened. The implementation of the population policy cannot be the sole preserve of the Ministry of Planning. It must cut across every single sector and must involve government, not only at the national level, but also at the county level. We must advocate indeed that the resourcing of the population policy must be front and center, because without optimally capacitating Kenya's human capital, it will be difficult for us to achieve the development objectives that we seek. We must work with a range of partners who have committed to ensure we build capacity at all levels, county level, sub-county level, national level, to implement the population policy. And for every single initiative of government to keep its eye on human development, on the human factor. Our approaches have to be different. We must be willing to be innovative going forward in advancing the implementation of the policy, leveraging technology where feasible and where necessary to ensure that we optimize the socioeconomic environment for the interest of every individual Kenyan. And as we listen to the Chair of Mandeleo, currently I'm speaking from the venue of the Generation Equality launch by His Excellency the President. The population of Kenya at over 47 million is about 50% women. And we will not be able to achieve our development objective if we do not optimize that capacity, if we do not allow both men and women to optimally contribute to national development. As we always say, women constitute about 50% of the national population and they give birth to the other 50. Our teeth can only work together when they bite together. We must create systems that enable women to optimally thrive within the national economy and move forward. In closing, I will quote a great Kenyan and Nobel laureate, Professor Wangari Maathai. She once said clearly that until you dig a hole, you plant a tree, you water it, you make it survive, you've done nothing. You have merely only been talking. The last few days have provided us the opportunity to dig the hole and to plant the tree. The hard work now follows for us to ensure that we have a population policy that's not only relevant, but is ably implemented for the benefit of every Kenyan. I thank everyone who has participated at this conference, but more importantly, the organizers who have done a remarkable job. It's been an insightful experience. It's been a rewarding experience. And it's time for us to make sure that through this policy, we create an enabling environment for every single Kenyan. Thank you very much, Asante Sana.
Thank you, Dr. Ademola. Thank you very much. Dear delegates, let's continue the conversation and let's plant more trees. Thank you very much, Dr. Ademola. At this juncture, our chief guest, our chief administrative secretary, Eric Fukola. I want to take this opportunity to invite our chair, Honorable Devin Ngugi, to take to make his remarks and also a vote of thanks on behalf of the council, but also to lead us again in moderating the following the next session. Welcome, Chair.
Our chief guest, the Chief Administrative Secretary, State Department of Planning, Honorable Eric Simiyu, all executive members drawn from national and county governments, all members of parliament, Principal Secretary, State Department of Planning, Mr. Saitoti Terome, NCPD Board Directors, Chair Maendeleo ya Wanawake, Mrs. Rahab Muyu, Chair, National AIDS Control Council, and also County Director of PRB, Ms. Ajarina Siparo, Economic Secretary, Mrs. Mwoki, all participants, especially Dr. Dimori of UNPA, all participants from national and county governments, ministries, departments, and agencies, and all participants drawn from academia, NGOs, CSOs, and media. Ladies and gentlemen, I first take this opportunity to thank the Almighty God for making this conference a success. We have been able to achieve the conference objectives as presented in the conference communique by our Director General at the beginning of the conference. Secondly, on behalf of the National Council for Population and Development, I want to thank our parent ministry, Ministry of the National Treasury and Planning, for their support during the whole process of planning and execution of the conference. In particular, I want to thank the Cabinet Secretary, National Treasury and Planning, Ambassador Honorable Ukur Yatani, who represented His Excellency, the President, in the official opening of the conference. Equally, I want to thank the Chief Administrative Secretary, Honorable Eric Simiyu, and also Principal Secretary Planning, Mr. Saitoti Terome, for their support during this conference. I want to appreciate the moderators and panelists for their insightful contributions, which will feed to the population policy. I also thank the development partners, namely United Nations for Population Fund, UNFPA, Population Reference Bureau, PACE Project, JPO, and AFIDEP, for their support, both material and through contributions during the conference. I thank all the delegates, drawn from the national and county governments, academia, civil society, media, students, among others, who have attended the various sessions for their attendance and contributions, which will enrich our population policy. I also want to thank the NCPD staff, led by our able Director General, Dr. Mohammed Sheikh, for planning, coordinating, and following up on the various issues to ensure the conference was a success. Lastly, I want to thank all whom, in one way or the other, contributed to the success of this conference. I want to assure you all that we at NCPD will work with you, and especially my sisters, Angelina and Lahab, to see the successful implementation of the conference recommendations and policy. May God thank you and bless you all. Thank you. And now it's my honor and duty to invite our chief guest, Honorable Simiu My apologies. Before I invite our chief guest, Honorable Simiu, may I invite our Principal Secretary Planning and our friend, Mr. Saitoti Torome, to give a few remarks. Principal Secretary, please.
Our Chief Administrative Secretary, Mr. Eric Simiu Wasuko, the Chairman of the Board, Honorable Bugi, the Maendeleo Nawake Chair, DG, NCPD, the EPS, and all present. Good morning. As you all know, the population subsector focuses on implementation of population policy for national development, which is currently being revised to address the country's governance structure, new and emerging issues, and also align it to the national, regional, and international obligations. The goal of this policy is to attain a society in which all the people are secure, healthy, broadly educated, and empowered for improved quality of life for the current and future generation. Currently, the key population challenges include rapid population growth rate as compared to the job creation, leading to high youth unemployment rate. Secondly, high dependency ratio, which increases the dependency ratio on the working population and hence negatively affecting savings and investment levels. Congestion in major urban cities and urban areas, leading to strain on the basic resources like water, healthcare, education, and infrastructure. Number 4, and sustainable utilization of available resources, leading to environmental degradation, pollution, and increasing climate change vulnerabilities, among others. These factors hamper development progress in the country. To achieve our population goal and the Vision 2030, including other national, regional, and international policies and obligations, among others, sustainable financing towards population program is critical. Therefore, the following interventions should be employed. Government investing on domestic resources towards population program and ring-fencing the resources allocated. Secondly, establish and strengthen partnership with private sector and development partners and exploring innovative financing options. Third, investing in research and innovation for provision of data for evidence-based decision-making in the population program. And finally, profiling agenda for population by making population issues a central discussion in matters of development and planning. With those few remarks, it is now my humble pleasure to invite Mr. Eric Simiyu Wafula, Chief Administrative Secretary, National Treasury and Planning, to come and officially close this conference. Thank you and God bless you. Very good.
Good morning. Are we in the afternoon yet? Not as yet. It's my great joy to be with us here today as we come to the close of an exciting 3-day conference that has brought together different stakeholders in this space of population and development. I say that I'm very proud of the way the team organized this conference. I logged in on Monday and I stayed in up to today is when I've not logged in because it's in person, but I have learned quite a lot. And I want to just express my gratitude. What I'm hearing. I want to appreciate the team that is here today, is that there is a challenge coming from the think tanks. And the challenge is saying that our development priorities should emerge out of evidence that is coming from the think tanks. And that evidence comes both at the design of the programs, but also it comes through the monitoring and evaluation processes, where lessons learned in how we're implementing projects and programs should be integrated in our subsequent plans. I think that challenge is coming out very clearly in terms of the plans that we take on as development priorities for the country. But I'm also seeing what we also envisaged in the constitution of the country. When we linked the planning processes and budgeting processes, I'm seeing another challenge coming, that the budgeting processes should be informed by our development priorities for alignment. And when we want to make sure that we have proper stewardship of resources, that those two aspects must be maintained in a balance. And in a small way, we'll do to continue supporting this process as a team, working as a team to ensure that we have a conversation with the different persons, as His Excellency the President said yesterday, that there is no one person who can bring about transformation in the country. It will take all of us together, thinking together, putting Kenya first. We'll begin to see how we align the way we allocate our resources to where we want to go as a country. And I appreciate the fact that we also have recognized as a country that we cannot achieve the goals we set on our own. And so we have a partnership with some of our partners, global platforms, some of the initiatives that we do have speak into that, including our International Conference on Population and Development 25. It's speaking into the fact that we need each other. So I'm learning that particular lesson as I listen and as I watch, that when we're dealing with the plans that the country has, in order for us to move away from being talk shops, it must be reflected in where we allocate our resources. And that is where the rubber is meeting the road. I think in the commitment I have had a statement about moving from budget allocation to budget actualization, so that we begin to move into the processes where they say that where your gold is where your heart is, that will be realized. So those are my opening remarks. Now allow me to move into the more formal component here. And so our Principal Secretary of State Department of Planning, the National Treasury and Planning Ministry, Saitoti Torome, we want to appreciate you today for the support you give to this process and your own commitment that I have known for a long period. The other Principal Secretaries that may be here today, the Chair of the National Council for Population and Development, Honorable David Ngugi, we celebrate you, and a wonderful conversation that we had before the meeting began. We hope we can pick up and see how to continue this constructive dialogue. Our own DG, Dr. Mohammed Sheikh, for the wonderful plans and processes that you have helped put together to ensure that this conference is successful. Our EPC, Catherine Mwoki, we have followed you, the way you have worked behind the scenes to make sure that that there's flow in the deliberations and the outcomes that come out of this place. We want to honor our partners, country representative for the UNFPA, Dr. Ademola Olajide. And so we thank you for those comments that you have made and your contribution and support that has been expressed here today. We just want to urge that we continue that partnership to ensure that we help develop a country, a continent, and a world that is fit for human occupation. With development partners that are here today, we have quite a number that are represented here today, including the ones that were here, Country Director, PRB, Ms. Angeline Siparo, who has also excused herself for a meeting that follows. We have our chair for the Maendeleo Yowanawake organization, Ms. Rahab Moyu. We thank you again, we meet again. I think in the population space here, we want to celebrate you. And so we have the guests that we have here today. We just want to say, all the delegates, ladies and gentlemen, good morning. It's my privilege and honor to address you as we close the 4th National Leaders Conference on Population and Development. And I congratulate you all for successful outcomes of the conference, as we have heard. This will go down in history as a realistic promise for improving the quality of lives and welfare of our people. Your hard work and active participation in the deliberations in the last 3 days has come with information that will inform the revision of the sessional paper number 3 of 2012 on population policy for national development. The draft population policy finalization process will be prioritized to ensure that it is finalized and it's submitted to the cabinet for approval and tabling in Parliament for adoption. Ladies and gentlemen, the theme, investing in human capital to achieve Kenya Vision 2030, guided the deliberations for the last 3 days. The deliberations will guide the population agenda for the next decade. As leaders, it is incumbent upon us to spearhead the necessary initiatives that will accelerate the achievement of our development agenda. Specifically, we must give keen attention to a healthy and sustained development of the vulnerable segment of the population, being children in terms of nutrition and education, the youth in terms of their health and skills, the elderly in terms of social protection, as we see that senior citizens population increasing because of the increased life expectancy. Social protection would become critical for that population. The development of the vulnerable segment of our population is critical for us. So the youth holds the future of this great nation. We need to nurture them well in terms of health, in terms of education, in terms of training, so that they realize their full potential and contribute to the national development in all spheres. Whether we don't have our youth reduced into voting ballots and voting machines and used to raise temperatures in political processes, but the youth are our best for the future. And we must do all we can as government, as stakeholders, as partners, to ensure that we invest in the youth of this country. For we do all this for the sake of the future generations. The discussions brought out the urgent need to focus on how to harness the youth potential to reap the demographic dividend as a country. As you may be aware, the window to achieve the demographic dividends is opening up in many counties as we were subjected to the data that is available. And so we need to seize this moment. In this regard, we need to focus more investments targeting health and well-being, education and training, economic empowerment and entrepreneurship and good governance. Equally, we must promote gender equality and embrace women empowerment by giving women their rightful place in the development arena. During these 3 days, ladies and gentlemen, the legislature, government representatives, religious leaders, the civil society, partners, and young people have deliberated pertinent population issues, weaving around the 8 thematic areas. We have a task ahead of us, and I can appeal to our partners to join us in the implementation of the population program that follows this process. As we are all aware, ladies and gentlemen, population programs compete for the ever limited funds. This calls for collaboration with the private sector, the civil society, and the development partners. And today we have made resolutions in which we have committed to implement the population agenda. We will regularly review and assess how effectively we are implementing these resolutions. Ladies and gentlemen, the President is looking forward to receiving concrete, actionable, and cost-effective proposals that will address bottlenecks that hinder the achievement of the population development targets. In this regard, I am tasking the National Council for Population and Development to finalize the report, as has been indicated, of this conference and the draft population policy. This report will be shared with all delegates, I'm told. As I conclude, I wish to thank you for having participated in this conference and enrich the discussions that will go a long way in informing policy and program. I now declare the 4th National Leaders Conference on Population and Development officially closed. However, the hard work of ensuring that we implement the resolutions will start now. Asante sana.
Okay, please let's stand up for the national anthem.
Together, and the glory of Kenya, the fruit of our labor. tumeshuhudia uongozi ulio bora.